Meeting. Thank you for joining us today. It's a friendly reminder that if you'd like to make comment on any agenda item, please submit a comment card to member of county staff prior to that agenda item being called. We'll start with agenda item 1A, roll call. Will the clerk please call the roll?
Commissioner Bernard,
Here.
Mayor Kerner,
Here.
Commissioner Marino,
Here.
Commissioner McKinley,
Here.
Commissioner Sacks, Vice Mayor Weinroth,
I'm present.
Commissioner Weiss.
Here.
Thank you.
We do have a quorum with 6 county commissioners present within the county commissioner chambers. With Commissioner Sacks absent at this time, we'll move now to 1B and C, invocation and pledge of allegiance. If you'll please join me in rising, and Commissioner Bernard will lead us.
O God, we give into your hands the business of this commission. Guide our new and unfinished tasks to completion. Also help us bring our unresolved problems to a fair and just resolution. Help us to make decisions that will benefit all citizens. Amen.
Amen.
Pledge allegiance to
Thank you, Commissioner Bernard. I'd like to correct the record. We have all 7 county commissioners present within the chambers. We'll move now to agenda item 2A, additions, deletions, and substitutions. Madam Administrator.
Good morning, Mayor, Vice Mayor, members of the board. On page 43, 3I4 has been deleted for the staff review. Page 79, 3EE5 has been deleted. It was a duplicative item. Page 91, 6D2 has a revised summary with more specificity in the summary. Page 97, 7A1 has been modified to delete one nominee that is no longer eligible. That concludes the add and delete sheet.
Very good. Commissioner McKinley, you're recognized.
Yes, thank you, Mayor. In addition to those changes from the county administrator, I'd also like to ask that we postpone item 4A under special presentations regarding Lomax Harrell Appreciation Day. Mr. Harrell is not able to be with us today, so I'd ask that we put that on the next agenda.
Very good. Is there a motion to adopt the agenda as amended?
So moved.
A motion by Vice Mayor Weinroth, seconded by Commissioner Marino to adopt the agenda as amended with the add and delete as published, along with agenda item 4A, special presentation related to Lomax Harrell only. Are there any comments by members of the board? All in favor? All opposed? The agenda is adopted as amended, 7-0. We'll move now to the consent agenda. Would any commissioner like to pull any item from the consent agenda? Commissioner Weiss, you're recognized.
Thank you, Mayor. I'd like to pull item 3BB1.
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 Commissioner McKinley.
Yes, I'd like to pull item 3S4.
3S4. I'd like to pull agenda item 3H13. H13. Related to Mounts Botanical Garden. I don't see any other indications to pull any items to the consent agenda. Is there a motion to approve the consent agenda minus agenda items 3BB1, 3S4, and 3H13?
So moved.
The motion by Commissioner Weiss, seconded by Vice Mayor Weinroth. Are there any comments by members of the public?
No,
Are there any comments by members of the board? All in favor? All opposed? The consent agenda has passed 7-0 minus 3BB1, 3S4, and 3H13. We'll take agenda item 3BB1 up now.
Thank you, Mayor. I wanted to just disclose, this is funding for Speak Up for Kids of Palm Beach County, which supports our 15th Circuit Guardian Ad Litem program. And I just wanted to, for the record, indicate that my wife serves as a volunteer board member for Speak Up for Kids, but this has no financial impact to me or to my family, and I'd like to go ahead and move for approval of that item.
Very good. Commissioner Weiss has moved forward agenda item 3BV1,
Second.
seconded by Vice Mayor Weinroth. Are there any further comments? All in favor? All opposed? 3BB1 passes 7-0. Commissioner McKinley, you recognized 3S4.
Yes, thank you, Mayor. I'd like to ask the staff give us a very brief update on exactly what this is doing. I think it's pretty phenomenal. It's a continuation of a pilot project related to the opioid epidemic that we're still experiencing in the county and in Florida and in our nation, and I think it's important for the public to know of this service.
And this is related to the Treasure Coast Health County, Inc.,
Yes,
found on page
64.
64, very good.
This particular item is under our fire rescue department, and it's an agreement, understanding between the Treasure Coast Health Council and our group that will be administering the CDC ODA cooperative agreement with the health department. Under the letter of understanding, our fire rescue will receive funding for an existing unfunded 20-hour week on-call social worker, expanded hours for existing community paramedics, telehealth, and field-based intervention to support the opioid-related prevention components. This particular agreement has been in place. It's a pilot. We're extending it. And this is going to continue to provide the social work and the services that we need to surround some of our patients that we encounter. And so our staff has done an excellent job with it and with our partners, and so we want to continue to monitor it, and eventually, when we get the appropriate amount of funding, it can become a permanent program.
Mr. Mayor, this is part of the program that actually was one of the first things Palm Beach County did in partnership with the healthcare district to respond to the opioid epidemic, where somebody can voluntarily choose to participate in the program. It was originally started with JFK Hospital, the South County campus of JFK Hospital, where somebody would receive the first dose of medication-assisted treatment, 1 or 2 doses of that while they were in their emergency room, having been brought there, of course, as a patient of an overdose. Afterwards, they provide follow-up services to that patient's place of living, wherever that may be, for 8 to 10 days afterwards. They provide that medication-assisted treatment. As we know, the best outcomes come when you provide wraparound services to these patients. So this provides the therapeutic component of that service. They are then in long-term care with the healthcare district through their clinic on the medication-assisted treatment. But it's been a very successful program, and I just thought it was worthy of pulling it from consent so we could have alert the public that that program is still available. So with that, I'll move approval of item 3S4.
Very good. Thank you for recognizing the good work that's going on related to this agenda item on 3S14. Sorry, 3S4. A motion has been made by Commissioner McKinley on 3S4 to move for approval, seconded by Vice Mayor Weinroth. Are there any further comments by members of the board? All in favor? All opposed? That item passes 7-0. Thank you, Commissioner McKinley. And I've pulled 3H13, which is found on page 84. Page 41, related to Mounts Botanical Gardens. I'm very supportive of this agenda item. I just wanted to make special note that the bulk of the funding to the improvements to the Mounts Botanical Garden was raised privately by the Friends of Mounts Botanical Garden. It's a facility that we all enjoy, that the county enjoys immensely, and it is a very positive attribute to our county's footprint. And I personally do appreciate the private donations and efforts that have gone into renovating the face of this facility on our behalf and on behalf of the public at large. And so I don't have any further comments. Commissioner Bernard, you recognize, sir.
Thank you, Mr. Mayor. I agree with your comments because I represent that area. I think Commissioner Weiss, we both represent the Mounts Botanical Garden, and we do support the work that they do. Thank you.
Very good. Well, Commissioner Bernard has made a motion then on, did you have any other comments? On 3H13, seconded by Commissioner Weiss. All in favor, all opposed. That item passes 7-0. Vice Mayor Weinroth, you're recognized.
Thank you, Mayor. I didn't pull an item, but I'd like to request a review of it at another meeting. 3S2, the policy with respect to the collection of transport fees for emergency transport of our residents. Just like to have a little bit of a further overview as far as our policy for charging the cost of this to our residents, the collection fees that we're incurring, and the contract for the collection company as far as what our relationship is and how much of those collections are actually projected going forward. So, again, I didn't want to pull it, but I would like to have some further explanation in the future.
Very good. Thank you, Vice Mayor Weinroth. This is related to item 3S2 found on page 63. And we'll look forward to further comments at a later meeting or at a later time on this issue. All right, so that concludes the consent agenda, which passed previously 7-0, and now the 3 items pulled from it have passed 7-0. Are there any other comments or questions related to the consent agenda? Very good. We'll move now to special presentations found on page 84. Which include a proclamation that has been tabled for a later date on 4A and now 4B, COVID-19 update by Dr. Alonso and our emergency manager, Ms. Blakeney, which we're delighted to have you both here today. Good morning.
Is that better?
Yes, ma'am.
Can you hear me clearly? Okay. Well, good morning. Thank you, Mayor, Vice Mayor, Commissioners, and County Administrator. Glad to be here today. I bring you some quick good news and a little bit of forecasting so that we can go forward and go into the next few months with some information in terms of what's going on. So I'd like to start with my first slide showing where we are nationally. You can see that our peak has continued to go straight up, but now we're coming down a little bit. The deaths there for the last 30 days are still up, but we're seeing progress. And as you can see, the trend line for the cases is pretty much flat as opposed to going straight up the way it was before. So that's all good news. Likewise, I'm going to show you then what we look like now in the country. And you can see that there's actually some spots where the cases have actually gone down. We continue to have the same 4 colors: high, substantial, moderate, and low. So you actually can see some spots where it's gotten down to moderate and low as opposed to being all red. In terms of what's causing this, it continues to be the Delta. We're now at 99.1% of all the cases, of all the variants, continues to be the Delta. On August 30th, the Mu variant was classified as a variant of interest by the World Health Organization, but the CDC has not escalated this to a variant of interest in the United States. The variant reached a peak in late June with about 5% of the circulating variants, but it has since gone down, and right now it's down at less than 1%. It's actually 0.1%. So we're going to keep an eye on it, but it's not a concern right now. The Delta continues to be the predominant. It's the one that's causing the cases, and it's the one that's causing more positivity. So with that, we see that our numbers here in Palm Beach County have actually gone down. Our daily positivity for Palm Beach County on the red on top is 11.6. Significantly down from the previous weeks. Florida is at 13.5, and as far as the cumulative cumulative data, our total positivity is at 19.4. That has remained high, but definitely still going up a little bit. But Florida is at 21.1. So we're hanging in there, and most importantly, our number of cases for the week is only 5,548, which is a lot less. We were very close to 9,000 cases per week. So now we're down to 5,000. That's a significant decrease. So that's why you see the curve over here on the right-hand side with that number going down. Here's where we were at 9,000, and we're down to this number now, which is much more manageable. So with that being said, what we predict is that this will continue to go down a little bit more, and then as we get into the holidays, the travel, Thanksgiving, the holidays, and New Year's, that we'll see that spike that we saw in January to go up again. So we have to be ready. We can't let our guard down. In terms of our census tracts that we're seeing, this is where we were last time that we presented. You can see this was very dark. We even had to add 2 new numbers for the increases here. But now we see that that has come down. The colors look lighter, and it's consistent with what we're seeing in the decrease in the numbers. I decided to bring these 2 graphs because people keep saying that we're not reporting our data. It is showing up at the CDC website on a weekly basis. If you go, again, I've mentioned this many times, cdc.gov COVID tracker puts you right on this page, and you can go to the community level and look up Palm Beach County. It shows you the 7-day moving averages for your positivity, as well as the number of tests that we performed. And you can see our number of tests have gone up, and then they came back down here. And our positivity, as we're saying, for the last 7 days has gone down, the total positivity and the daily positivities. The other chart that's there right beneath it shows us our cases and our deaths. Again, reports that we're not reporting our deaths. Well, we are, and they're going to the CDC, and so that's where you can see them on a weekly basis. So you can see here that our total deaths in the last 7 days did go up, and now they're coming down, but for some reason this graph got cut off there, so you can't see the downward, but it's gone down in the last 7 days. And our total number of cases consistent with the graph that I showed you before, so those look the same. This is very important. This is our vaccination, and we attribute most of the numbers going down to the fact that we're getting this up. We've gone up by 12% since the July, and so all the efforts that we're doing in terms of getting this done is very important. What you see here is that for the 12 to 19-year-olds, we made this graph specifically so we could track the school-age kids, the 12 to 19, and you can see they've gone above 50%. So that's very good. That's the efforts that are being done, especially with the healthcare district going out and vaccinating at the schools, and all summer they spent vaccinating. They're going back to the schools now, different schools at a time, and vaccinating people there. So we've gotten a good uptake on that, and that allows us to see this number going up. What we have to do is to continue to get this group, starting with the yellow line, which is the 40 to 49, the gray line, the 30 to 39, and then this orange line, the 20 to 29. We got to get this whole group of 4 lines to go up here to the 70%. Because when we talk about the total vaccinated being at 72%, that's great, but that means that includes only 62% that have been fully vaccinated, both doses. And then there's ones that still have only 1 dose. So what we got to do is get this group up here at the 70%, because this is inflated by the group of especially the 70 to 79, which are way above 90%, as well as the 60 to 69 that are at 90%. So that inflates these numbers going up. The elderly, the plus 80, remain just under 80%. And so those are some of the people that we're still seeing, especially some of this group that have underlying conditions from nursing homes and so forth, going to the hospital and having problems as well as dying. So very important that we continue to work on these younger age to get those people vaccinated. And by the way, talking about that, there are lots of parents that want to get their kids vaccinated, especially those that are under 12 years of age. Some physicians are going ahead and vaccinating the kids off with the Pfizer vaccine off-label. The FDA has warned parents who desperately want to do this not to do it until the studies are completed and or if they're part of a controlled study that's going on. We really want them to have that emergency authorization and not just do it on their own until the studies are finished. So again, I want to give the thanks to the healthcare district for doing such a good job of going on and especially vaccinating these younger kids. It's been very successful. I also wanted to give you some very good information in terms of the monoclonal therapy that we've been doing. We've got our site. We get a report each week showing the numbers that we've done. This is the Westgate Park Recreation Center. It was started on August 19th. Our highest number in one day was 1,354. That was the last week of August 30th through September 5th. And our total number is 4,092 with the last report. This one says 4,053, so we've had a few more since then. Our numbers have decreased in the past few weeks, so we're down to about 150 per day. But the people are going there, and this is for people who become positive, have a positive COVID test, but are not sick enough to go to the hospital yet. They might have just some symptoms. They need to go right away and get the monoclonal therapy. Those are man-made antibodies that are infused into your body, either through an IV or they can do it under the skin. They put 2 on the abdomen and 2 on the upper arms, and that allows your body then to fight off and you don't end up in the hospital. So this is specifically for people who are at high risk and have possibilities of going into the hospital. And so those individuals can actually get treated and recuperate much faster, not end up in the hospital. So for anybody in those conditions, that's available. It is free. If you don't have a physician, they will do the prescription for you there if you qualify. And of course, if you have a physician, your physician can send you. This has alleviated the ER because the ERs were having to do that in the ER for clients that were coming into the hospital. So this has alleviated some of that work that the hospitals were doing. So it's very important, and I want everybody to be aware that it's available. So we need to continue all our mitigation strategies to stop the spread of the COVID. The Delta remains spreading it across the United States and certainly in our community, being very contagious and causing those breakthrough cases. The vaccinations remain the most important tool to stop the spread and save lives. The vaccines are working against all the variants and especially against the Delta. So even if it breaks through, people are not going to the hospital and they're not dying. That's the purpose of the vaccine. So the hospitalizations have decreased, but and you'll see the charts that Mary will give to you, but they're still at a critical mass in terms of capacity, mostly because of staffing. So it's very important that we continue to support the hospitals and continue to get vaccinated so many people aren't ending up sick. We need to prepare then for another surge with the holidays and winter approaching. And I encourage everybody that's listening, please get vaccinated if you haven't done so, not only to protect yourself, but your family and all our community. So with that, I'll pass it on to Mary.
Very good, thank you, Dr. Alonso. And just a reminder to members of the public, if you have a cell phone or other device, please silence it so that it doesn't interrupt the proceedings. Mary?
Okay. Thank you, Mayor, Vice Mayor, Commissioners, Administrator Baker. I'm going to present to you our COVID rephase program right now. And we'll begin with testing positivity. The upper right graph that's shown here shows the overall positivity rate, which has been increasing for the previous 9 weeks. Currently, the overall positivity rate is at 19.4%. At this time last year, our overall positivity rate was 12.79%. The lower left-hand graph indicates the positivity rate over the last 10 weeks of doing testing. But when it comes to the daily lab positivity rate, the graph in the upper right shows the daily lab positivity rate since last July. The lower left-hand graph shows our daily lab positivity rate, which has dropped now for the third straight week in a row. This week, we're averaging, as Dr. Alonso said, 11.6%, which is above our target of 5%. The daily lab positivity rate has been above 5% since July 13th. As it relates to the COVID deaths, although the last 4 weeks have shown an increase in the number of reported deaths, the graph in the upper right-hand corner shows that our overall COVID-related deaths have remained stable. The death rate currently stands at 2.12%. As it relates to MedAlerts, this is a representative countywide sample from Palm Beach County Fire Rescue. We can see by the chart in the lower left-hand corner that MedAlerts have decreased for the past 4 weeks. This past week, the average was more than 15 patients a day. This is down from the all-time high back on August 14th, where they were transporting approximately 33 patients a day. Now I want to share with you a little bit of information on the hospital reporting. As you know, on August 20th, Administrator Baker signed Emergency Directive 2021A, requiring each hospital in the county to report specific data elements each day by 11 a.m. Today, I will be sharing a few of these data sets. In order to maintain consistency in the report today, the information shown today reflects only the dates when all of the hospitals reported. So this will represent 13 of the 23 days since the directive was implemented. This first graph shows the number of new COVID-positive patients admitted each day compared to the COVID-positive patients discharged each day. You will notice the red line represents COVID patient admissions, and the green line represents COVID patient discharges. The next graph represents the number of staffed beds each day compared to the daily bed census. You will notice the red bar represents bed census and the blue bar represents staffed beds planned for any given day. This next graph represents the number of COVID-positive patients admitted each day who are vaccinated compared to the number of admissions who are not vaccinated. You will notice the red bar represents unvaccinated patients and the blue bar represents admissions of patients who are fully vaccinated. As it relates to ICU use of adults, this graph represents the number of adult ICU beds in use. You will notice the blue bar represents the total of number of adult ICU beds in use each day, and the red bar represents COVID-positive adult patients who are in the ICU. As it relates to ventilator use, this graph represents the number of ventilators available, ventilators in use, and ventilators in use with COVID-positive patients. You will notice the green bar represents the total number of ventilators in inventory each day. The blue bar represents the total number of ventilators in use, and the red bar represents COVID-positive patients who are on a ventilator. As we continue to monitor our countywide positivity rate and hospital surge, we need to keep encouraging residents to get vaccinated. Our Public Affairs Department continues to maintain a list of resources on our county website where our residents can go for vaccines. In addition to vaccines, we're encouraging residents to get vaccinated. With the increased demand for individuals getting tested, we continue to maintain our testing resources. There are over 160 locations throughout the county, and many of these sites are open 7 days a week. We have vaccinated over 941,000 people in Palm Beach County, which represents 72% of our 12-year and older population. We need to continue encouraging people to get vaccinated while we wear our masks, wash our hands, and watch our distance. That concludes my report.
Very good. We'll take questions from members of the board, and I'd like to start with, first of all, thank you very much for the update, and it seems like things are improving. You discussed the directive to obtain hospital data from the hospitals that is under the purview of the county administrator. The basis of that is a direction and decision by this board to maintain a local state of emergency, which is executed by the county mayor on a 7-day rotation, unless the board directs otherwise. Can you give this board an update as to the value of that state of emergency and the data that comes with it?
I mean, at this time, it's really allowed us to have the opportunity to assess all of our situational items that are going on, whether it be not only the hospitals, but testing. We've actually talked about the option with the hospitals. There's been a lot of hospital communication going on at various different levels, not only some of the individuals through our Healthcare Emergency Response Coalition, but also with our county administrator, our assistant county administrator, with the hospital CEOs, to really get an assessment of what some of those resources may be needed. And having that emergency directive in place and the state of emergency would allow us to backfill should we need to in an extreme situation. I think what it's really gotten to at this point is really opened our eyes that it's a staffing issue at the hospitals. But the hospitals are doing an amazing job handling that staffing issue and dealing with their patients. And not to say that there weren't some tough days. I think they've openly expressed that it's been an opportunity for them to juggle staffing and patients. But just keep in mind, when we're doing this directive and we're asking them for their staffed beds each day, that's a planning number. They're planning and they don't know what's going to walk in the door any hour or any day. So that's why we'll see our numbers fluctuate. We've been keeping an eye on that. We've been in a really good situation here with our ventilator usage. Other communities haven't been that lucky and have had to reach out and get additional resources. So just having that ability to, at any moment's notice, we could reach out and fulfill a resource need, that's been the benefit of having that state of emergency in place and us getting that information on a daily basis. Although it's a snapshot in time, it's giving us a good picture of what's really happening in the hospitals. And the hospitals have been tremendous at reporting as well as communicating their needs to us.
Very good. Madam Administrator.
Just to elaborate a little bit more, I think that our partnership with our hospitals here and the partnership among the hospitals, this has definitely grown. Our intent is to also bring in the health department and representative and the healthcare district at our next meeting so that we're all on board. I think that the monoclonal system has definitely helped ease some of the crises that we're dealing with in our hospitals. But I think, as Mary adequately pointed out, what we have learned is that it's definitely a staffing issue. And so it's going to take the community to help continue to reduce that staffing demand, because the more people going into the hospital, the more the crises. Their nurses are leaving for better pay in other places, but our administrators have definitely been doing an awesome job in maintaining and making sure that they provide services to people coming in their doors. And they are doing it in a safe manner. They are transferring patients when they have those openings in staffing. And so it is definitely a community effort. And we want to thank our nurses, our doctors, all the people that work at the hospital. I cannot say that enough, because a lot of them are working double shifts. They are doing an outstanding job, and the public needs to know that they are working extremely hard and doing an excellent job for us. But we've got to help them. We've got to get vaccinated. We've got to wear our masks, stay the distance, and avoid crowds. What we anticipate is that with the Labor Day and football games, we may see a spike and we need to be prepared for it. So we'll be working with our hospitals in that regard so we can be in a proactive mode rather than reactive.
Very good. And to Mary or the administrator, with regard to the local efforts of monoclonal therapies, I think that we had some involvement in setting up, at least in Belglade and Commissioner McKinley's district with her assistance. Can you give us an update on how that has played out?
It's available at Lakeside Medical Center.
I think it has played out well. We had the opportunity to work with the state to get them here. We opened our Westgate Community Center for one location, which is central in the county, and then the healthcare district opened Lakeside. And so we've got two areas that is free. This is not the solution to this pandemic. This is just a treatment, and it's an emergency use authorization type treatment. So don't depend, I'm telling the public and everybody, don't depend on monoclonal. You need to take the appropriate measures. This is to avoid you going into the hospital and hopefully not dying. So please, by all means, continue to get vaccinated and get vaccinated.
Is there any indication that these resources won't be available to the public in the near future? And I'd like to commend Commissioner Bernard, who had a crystal ball several months ago in seeing the value of this treatment, and it looks like the statistics show that 5,000 people have been able to utilize it in our county. Is there any concern from either the state level or from a resource level that this will not be an option in the near future?
Not at this time. It's very popular.
Yes, it seems to be very popular and very effective. My last question pertains to, and the board, and we all join in celebrating the heroic efforts of our hospitals, the doctors and nurses, and all, the entire spectrum of staff within the hospital system. On certain days, there, as you mentioned, I think on a couple of days, there were hospitals that weren't able to report. Certainly, we don't want our actions under the state of emergency to cause any workload or burden on them in reporting this, but there were days where the hospital system wasn't able to fully report. Was that an issue of just getting these processes in place, or was there any underlying issue about them not wanting to report?
The directive asked them to report by 11 a.m. We start monitoring that information, and if we see a hospital hasn't reported, we're proactively reaching out and trying to get that data. But we do have that commitment, and we want to commit to posting that publicly each day. So we've set a timeline at 2:30 to post it on our website. And so there's a clear cutoff. But there have been some that have come in. They might be a little later and they don't make that day's report. So it's just, I think, a matter of their workload for that day and getting that to us in a timely fashion where we can include it on that day's report. But they've all been very accommodating when we call them and trying to get us that data.
Very good. And on that point, again, promise my last question, and then we'll get to other commissioners. Has the authority granted by the state of emergency been utilized by the county to obtain any other resources or utilized for any purpose outside of the stated purpose as executed by or directed by the county commission?
It has not.
All right, very good. Thank you for answering my questions. We'll go now to Commissioner McKinley, then Commissioner Marino.
Thank you, Mayor. A couple of questions for you. First, let me be very, very clear. The state of Florida did not help us set up the Regeneron Treatment Center or the Monoclonal Therapy Center in Belglade. Our office and county staff saw it as a need because transportation to Westgate was a factor. And so I want to thank Todd Von Laren and I want to thank Darcy Davis from the Healthcare District in making sure that site was set up. It was opened last week, so we're very happy to have it in the community. And while I think that Regeneron and monoclonal therapy is a great treatment option, a couple of questions for you, Dr. Alonso. Can you repeat exactly how that's administered again?
Yes, it's been approved now, both an IV infusion, where they put it into your blood system directly, and also it can be injected under the skin. What they're doing now is 2 shots on either side of your abdomen and 2 shots on your arms. So
Okay,
it's been approved for both. The advantage of injecting it is that it's much faster, and so that's what's being utilized at the site.
okay. So you can either have a needle stuck in your arm and fluids infused into your veins, or you can get 4 needles stuck in your body, 2 in your stomach and 2 in your arms,
That's a good way to describe it.
versus a vaccine that's at a maximum how many needle sticks?
Well, most of them are 2 shots, right? For the Pfizer and the Moderna, and the J&J is 1 shot.
Okay.
Much
and-
quicker.
And then the ingredients in monoclonal, are they, I think you stated this, are they naturally occurring in the environment or are they man-made?
These are man-made antibodies that make your body produce the antibodies against the protein spike on the virus, on the coronavirus. So it's a man-made way of giving you antibodies, as opposed to the vaccine that uses the messenger RNA to make your body produce those antibodies yourself. So the
Okay.
vaccine is a different process than injecting those man-made antibodies into your body.
Okay, and exactly what are the ingredients, those man-made ingredients? What's their chemical name?
I don't have that information.
And according to the Regeneron website, the treatment is still investigational, which is similar, I think, to the Moderna and the Johnson & Johnson vaccine. Has that changed?
No, it's still the emergency use authorization, just like all the vaccines were, except for Pfizer, who has FDA approval now.
Okay, so for the people who are opposed to getting vaccinated, but they're okay with getting monoclonal therapy, both are investigational, both are man-made, both involve sticking needles into you. I think I've made my point. It flusters me to think that somebody would be opposed to getting the vaccine, but they're okay with getting the virus and then getting a treatment that really has the same FDA status as the vaccine does in the first place. And then there was a gentleman that appeared yesterday. The governor held a press conference. I'm not sure if it was yesterday, but it was recent. I thank Senator Jason Pizzo from the Miami area for posting a link to it yesterday. There was a gentleman who spoke, and it wasn't disputed by the governor or any of the staff that was standing there, but he said, your RNA changes your DNA. Is that true?
No, ma'am, that is absolutely not true. The messenger RNA is just a piece of protein that goes, your white blood cells then go into your, it sends a message to your white blood cells who, through their T cells and B cells, create the antibodies. That piece of messenger RNA, which is a piece, disintegrates in your body and completely goes away. There is no lingering, there's no virus inside the vaccine. That's another misconception, that you're going to get the virus because you get the vaccine. So that does not in any shape, way, or form go into your DNA. It's not DNA at all. It's a messenger RNA that only gives a message to your cells to create antibodies. And it's the future of vaccinations into the future. This is something that I don't think is appreciated yet by the community, of how much progress this will make in terms of vaccinations for the future.
Okay. And Dr. Alonso, just for the record, could you tell me what your educational background is for you to make that statement?
I'm a family practice physician, and I have a 2nd degree in preventive medicine, public health.
Okay, thank you for that. A couple other questions. I first heard of the Mu variant last week. Do you know what is it worse than the Delta variant or similar? What's the difference between the two?
It's a variant, just the viruses make variants, that's normal, we expect that. The reason this has gotten so much interest in South America is because it was looked at in a very small study and thought that it might not be, the vaccine may not work against it. In other words, it was afraid that this was the one that had finally mutated to the piece where the vaccine wouldn't work, but that seems not to be panning out. And like I said, it has decreased, so the interest, at least from the United States, has gone down. We're still monitoring it, but we haven't declared it a variant of interest yet.
Okay. I appreciate you sending me the census tract data each week. It gives numbers in a range, nothing specific, not very helpful. Where is the zip code data?
Did we bring it up today?
The positivity zip code data.
The,
For positivity.
what we have on the zip code shows the vaccinations. What you see on the census tract is the number of cases. They're two different things. So what do you want to look at?
Last year, you gave us weekly updates that included zip code level data. So the data broken out by zip code so that we could, rather than countywide, we could look at the exact number of cases within a zip code and target resources.
You have that on that census tract. It does, the colors are in your census tracts. But if you look on the Excel spreadsheet that's sent with that map, that has the zip code. So you can look it up and it shows you the zip codes. But it's going to give you a number.
I know, I've got to go to each census tract and pull the range, and then I get a range of positivity rates, but last year it was-
It's not positivity rate. It's just number of cases.
I'm sorry, number of positive cases
Right.
within an area.
That's the same thing you were getting before.
But is it the exact number or is it the range?
Well, if we did the exact number, each one, we'd have to have thousands of colors. Well, not thousands, but how many zip codes do we have? So the reason we put it in ranges is so that we could have ranges within those census tracts. If we had just, I can't give you numbers like by houses because that's identifying people. So part of the range is so that we're not identifying any individuals. Anywhere where there's less than, I think it's 6, we don't put anything because it's too close to being able to identify people. So part of that is to protect individual counts where there's small numbers. But the range is to give you an idea of which areas have growing numbers, because before all we had was a cumulative, remember? Mm-hmm. And that was useless because of course it kept growing and growing, so pretty soon the entire county was red, and that was useless. So what we decided to do was let's break it down by census tracts because some zip codes are too large to decide how many cases were there. So for the municipalities, it was more useful to break it down by the census tracts. Now, I know your point. You said, well, if I just want to know the zip code, then I need to add up all those municipalities. Yes. So, we're trying to do it so that everybody wins. The municipalities can get it by census tracts. If you want to get it the whole zip code, then you have to add up that area. But I'm only going to give you that range so that we can manage the map and have just a certain number of colors.
Well, the zip code data was very helpful last year, and it helped identify hot spots, and it made it easier to respond than this data with these ranges. It's just very frustrating.
But
I
if
don't
I give you-
understand why we were able to get that information a year ago, and then it's being provided to us in a much different
But we
format.
didn't have it by zip. We never had that map by zip code. We only had it by census tracts because the municipalities asked for that.
Ms. Baker, did we not have the information provided by zip code last year? I mean, I know it helped identify hotspots out in my district.
I think that we accumulated the information by census tracts, but our staff converted it to the zip code. So we have had maps based on zip code. And that's the map that Beth and on our staff
Okay.
provided for us. So we should be able to still provide those zip code maps.
If you do that, then you're going to see a really large number for a zip code.
There are some zip codes that are larger than others. If you'll remember, we had that discussion with the zip codes one of the zip codes out in the Glades, but yet also included parts of Loxahatchee, et cetera. So those are the exceptions, but we've got areas that are reasonable, and we've been reporting based upon zip code.
Well,
So
I'd
we can
like-
bring that map back.
Thank you. I'd like to see that map come back. Additionally, we had 4 high schools, 2 of them are in my district. The highest positivity rates in our high schools, the number one is Seminole Ridge High School in the Acreage. Number 2 is Jupiter High School. Number 3 is Wellington High School. Number 4 is Boca High. So for the Acreage and Wellington, being out in kind of the central west part of the county, are we doing anything? Are we talking with the school board, talking with those communities about trying to bring in some resources to bring those numbers down?
The Department of Health, the healthcare district, and the school district have been almost in daily communication with one another. We're looking at different efforts that we might be able to put in place. The biggest problem right now is how many children we are having to quarantine on a daily basis. And the positivity of the ones that we're quarantining at this point is about 16%. But we're sending a lot of kids home with that 16% of positivity that comes back. So we're looking at different things that we could do. I mean, obviously the number one thing would be to get everybody vaccinated, because if you're vaccinated, you don't have to go home. And you're not, you're going to have a much better chance of not being positive. We have had breakthrough. We have had cases where children have made other children positive, but most of the positivity is coming from the home. In other words, the birthday parties, the outside activities that the families are having outside of school. But we have had breakthroughs in the schools this year that we didn't have last year. However, again, the issue is there different ways that we could utilize to keep most of the kids in school? And one of those methods that has been used in some other states is more testing. So we did bring, again, resources from the state down so that the school board would have a testing. They have 2 testing sites for their students and their teachers that they can get tested so that they can come back to school quicker, so they don't have to wait in lines. But in addition to that, we're looking at other alternatives that would allow more of the kids to stay in school by testing actually at the schools. Right now, that's just preliminary, but we're trying to see if we can help with that. So I think that would be a win-win for everybody if we can keep more kids in school without having to send them home.
Do you see a relationship between the school district's requirement to mask students and our numbers decreasing across the county?
All the mitigations to stop the spread help those numbers go down. So, that's a really, really strong opinions on both sides. The families that want their child to be masked and oppose children sitting in their classrooms that are not masked, and then those that don't want to wear masks. So that's been, a big dispute among the school members as well as the parents. Only 4% have opted out of mask use in the schools at this time in Palm Beach County. So that continues, and I don't think that's going to get resolved anytime soon.
No, I can't help but notice the numbers have gone down since that order was put in place. Mr. Mayor, thank you for your patience and my questions. I just have one last comment. If you haven't heard, in a 2-week time period, my aide, Lisa Wilson, who runs my my Glades operations for my district, in a 2-week time frame, her grandmother died, her uncle died, and 4 cousins died. None of them were vaccinated. They were scared of the vaccine because of ridiculous things they'd seen on the internet. And that fear they're now dead. Very, very sobering. I ask that you pray for the Wilson family. She's really struggling, and I can understand why. It's been very tragic for her family. And if you are willing to get 4 shots, and 2 of those being in your stomach, please reconsider your anti-vaccination position and just go get a vaccine. Thank you, Mayor.
Thank you, Commissioner McKinley. We'll go now to Commissioner Marino, then to Commissioner Sacks.
Thank you, Mayor. Quick questions. On page 10, you talk about the hospital ventilator usage, and this is probably a rhetorical question, but in your COVID, your numbers of people who are using a vent that have COVID, and you have the total vents in use, so looking at this, about half of your vents in use are being used for COVID patients. However, at this time last year, we had no ventilators available for those without COVID. So let me rephrase that. The ventilator supply was a lot smaller last year at this time, in the sense of who was able to use a ventilator. No, you're shaking your head.
I don't think so.
I would have to go back and, I would have to go back and look at that data, but we were monitoring actively the ventilator use, and I don't believe we ever got below 80% in use, but I can definitely go back and look at those figures. But our ventilator usage has been extremely stable.
Okay. Well, from looking at this, it shows that half of our ventilators are available, so that's actually a very positive note. Dr. Alonso, can you talk a little bit more about boosters for those that are listening?
Yes, there's 2 terms that are being used, and it's important to know which one to use. The boosters haven't started yet. The boosters are going to be for healthy people to get that extra dose for extra protection. What we have approved is the 3rd dose, instead of saying booster. It's the 3rd dose for those individuals who are immunocompromised. And that means that you're either an active patient on chemotherapy, you have an organ transplant, HIV, rheumatoid arthritis where you're on corticosteroids, or some other decisions based on your medical history where you're immunocompromised. If that's the case, it's been recommended for those individuals to get the 3rd dose. You have to get the same vaccine that you originally got, so it's either for Pfizer or Moderna. J&J studies have not shown the need to get the booster, so at this time, J&J does not get neither a booster nor a 3rd shot. And the only difference, again, is that with the 3rd shot, you can get it within 5 weeks of your previous vaccine, and with the boosters, you're going to wait 8 months to get it in between because you're not immunocompromised. So it's caused a lot of confusion, but you have to sign a paper saying that you are immunocompromised, and those are the people that should be going out to get that at this time.
So the booster and the vaccine are the same thing?
The booster and the 3rd dose are the same thing. It's going to be the
same thing.
Yes, and it's the same vaccine. There's not a new vaccine for it.
Okay. And on a personal side note, thank you very much for answering my questions. You are an amazing woman and have a lot of patience with all of us, and you actually helped me have my mom climb in off the ledge, so I do appreciate that. Thank you.
Not a problem.
Thank you, Commissioner Marino. We'll go now to Commissioner Sacks.
Thank you very much, Mayor. And I want to thank both of you, Dr. Alonso and Mary, because I heard a very good statistic, and I just want to make sure it was correct, was that 72% of our population 12 and over are vaccinated.
Have at least one
Excellent.
vaccine.
Excellent, excellent.
very
Nice.
good.
Nice job. What concerns me is what my colleague, Commissioner McKinley, was talking about. And I think there's 2 issues. One is, are we making the van, and I know, Mary, you had mentioned before that in the Glades area that we have a van, or we have a facility at Lakeside Hospital to give vaccinations. But I know we also have a van. Can we not, to take care of the issues that Commissioner McKinley spoke about, I think one way of a solution is make it available, easily available to the people. But one of the most important things is what Administrator Baker said at the very beginning of this issue last year: education, education, education. So obviously, the people who are not getting vaccinated and who are suffering and dying are not educated in terms of what the real facts are in the vaccine. And maybe number two, it's not easily accessible. What, if anything, I'm looking at solutions, what, if anything, can we do as a county to help the folks, not just in the Glades, but throughout this county? One, get educated, and two, to make sure that the van is right there. I think it helps so much. If it's right there, you don't have to get in the car and drive. First, what can we do about educating those pockets in our county that are reticent or refuse to get it?
We have several agencies that have community health care workers that are actually going out into the community and doing, giving out information, because a lot of this has nothing to do with education. It has to do with personal beliefs, and it's not a lack of education, it's a personal decision.
So in other words, people are educated, but they refuse, after being educated, they refuse to get the vaccine.
Yes, their choice is not to get vaccinated. Now, there are misunderstandings and false information that is on the internet. And so when these community healthcare workers go out there, we talk about those things and we give that information out. Last night, we had an excellent forum where we talked. We had physicians, we had infectious disease physicians, we had OB physicians talking about that, the vaccine does not cause infertility at all, and, dismissing some of those myths. And I think that's where you're saying that some people still have these misinformation. That's available. As far as having the vaccines available, they are very available. We have gone to churches, we have gone to businesses, and that's what we're doing now. That's both the healthcare district and the health department. The health department has 2 vans, the healthcare district has 3, and those have been all over the county, especially in areas where there's low vaccination rates. We are specifically targeting that. And if you look at the map that's up on the pbcgov.org, you see that those areas with the lower vaccinations, the vaccination rates have increased. So we're very specifically targeting those areas. So it's not lack of availability, it's people making a conscious decision not to get vaccinated, such as the family that Commissioner McKinley's talking about. There's no amount of education that you could give those folks because they just have made that decision not to get vaccinated.
So we're now at 72%. And at some point, we may cap out in terms of people who understand what their choices are, but refuse to follow it. Do you have any idea, maybe we get to 80%, that maybe would get herd immunity so that those who are vaccinated would not suffer the consequences of getting infected by those who, they're right, I guess, to not get vaccinated? Is there a number, doctor, that we can look at?
We felt that 70% fully vaccinated would get us to that.
Okay.
The issue now is the Delta that is causing breakthroughs in people that are vaccinated.
That's what I'm talking about, yes.
That's okay if you have the breakthrough still is low. And those people are not dying, they're not going to the hospital. So that's okay. It's still worth getting vaccinated because those people are going to be protected and that will give us herd immunity. Now, we have to also add into the numbers, and there's no way to actually calculate that at this point, is we have to count the people that have, even though it's lower protection, natural immunity because they've had the virus, right? So that's about 50% as opposed to the vaccine, that's 90% more or less. So there is some immunity there. So between the people that have naturally gotten the virus and the vaccinations, we will get to that at some point. The question is, how long will that take? And this
Right.
has to be done globally. We can't have a fantasy that if we do that in Palm Beach County, it's going to solve our problem. Because
But it will lessen certainly the hospitalization and the deaths, because we're looking at two things. 72% of this county has at least had one shot, been vaccinated. And usually if you have one shot, you're going to have a second. Secondly, we are looking at about 50% of the population who have natural immunities based on their already having COVID and obviously recovered from it. So we're getting closer. Am I an optimist here? We're getting closer to being able to protect all of us.
Yes.
Okay, now let's go back to something else that was of concern to me. And we know that the trend is going down, and your charts were excellent. But do we know about the kids, the pediatrics, ICU? And when I talk about kids, I'm talking about those children who are under 12, cannot receive a vaccine, and who we somehow, the adults, are either because we are not getting vaccinated or for some other reason, being maybe as a carrier of this Delta variant, we are infecting our own children under 12. Is there anything that we can do? Well, first of all, do we have any statistics on our ICU beds that are taken up by children under 12?
Yes, it's a small percent.
Oh, okay, good.
Was it 2%, 1%?
I didn't see it on the chart, so you don't need to look.
Yeah, I
was
didn't do
looking
that
for it.
comparison, but we do have all that data as well, and it is a small percentage that are
Okay.
being used by pediatrics.
What we do have is we have had an increase in the number of cases in children under the age of 12, no question about it. Those kids are not vaccinated, and therefore the Delta is infecting them, no question. Especially the 11 to 4. Okay? Under 4, it's still a small number, but it still has increased. And some of those kids are going to the ICU. They're not dying, okay? But my concern with the kids getting the COVID is the long-term effects
Right.
that they will have, okay?
This is something we'll be dealing with for many years to come.
Yes, including the inflammation of the heart, the trauma to the brain, because when you lose your smell and your taste, that means the virus is in your brain. So, this virus attacks other organs. It doesn't just go to your lungs. It goes to your liver, to your kidneys, and so forth. So that is concern that's not being measured by anything on a chart yet. The number of cases, yes, they've increased. And so in the meantime, what those families need to do, of course, is get vaccinated themselves, stop the kids from going into crowds, using the masks over the age of 2, anything that they can to protect that child from getting infected. And
concerns
most
me.
families are doing that. That's why they're so desperate to get the vaccine. A lot of the people are waiting for that vaccine very anxiously. We hope to have the Pfizer vaccine in late fall, early winter. So it'll come just in time before we spike again.
Very good. Thank you very much. Thank you. I love to see those charts going down.
Me
Thank you very much for your work.
Very good. Thank you, Commissioner Sacks. Commissioner McKinley, did you want to respond to a point related to this or just be recognized in the normal order?
Normal order.
Normal order, very good. We'll go to Commissioner Weiss and then to Vice Mayor Weinroth.
Thank you. Good morning, and thank you both for your presentations today. This morning on the news, I heard a story come out of California. It was regarding a couple, a young couple. I guess he was 39, she was 37. She, a few weeks ago, came down with COVID and delivered a baby, but she succumbed to COVID. And then a few weeks after, she died, he died. They left 5 children. 5 children, they were ranged in age from 7 to 3 weeks because of this virus. And I'm just, it's, obviously there's, people made those decisions, but now there's 5 orphans without their parents. And I just ask that parents think about that and what would happen to their children. You talked about, we talked about monoclonals and the effectiveness of it. But my understanding with the monoclonals as well, though, is, I mean, there's a cost to them, no cost to the people that are coming to our clinics, but the government is picking up the tab for that. And it's about $1,500 a dose, is my understanding. So that means in Palm Beach County, we've expended about $6 million in providing monoclonal treatments to folks, and so far in the state of Florida, it's about $123 million. And I just bring that up not to say I'm glad we have it and to help people from getting really sick, but there is a cost to it as well. I mean, you may not pay the bill, but somebody's picking up that tab.
That's true.
So I'll bring that out. And then the last, and this is really for our, because my colleagues have asked all the other appropriate questions, but this is for our legal counsel. Recently, we've been getting a number of emails, I think every commissioner has been receiving them, regarding a countywide mask mandate. I know we require mask usage in all of our buildings to protect both our workers and the people that visit our buildings. Can you talk about the law in Florida now and limitations on local governments?
Well, our governor has limited our ability to do a lot of things in Florida because of his beliefs that there should be personal freedoms. We have the ability to do things for our employees and for our people who are using our facilities, which is why we mandate masks in our facilities. But as far as county-wide options, we're pretty limited as far as what we can do. Businesses can still set their own parameters for their businesses. If they want to require masks, they can do that. They cannot require vaccines for visitors. We are not allowed to require vaccines for visitors. We can require vaccines for our employees. So we are currently in the midst of a very troubled water environment. It's our ability to take action is in large part limited. And that's why we have a state of emergency that is carefully crafted to enable us to get the information that we need in order to move forward and request, assistance. But we can't just require people countywide to do things.
And that's due to the legislature passing a law and the governor signing that law?
That's correct.
So this is different than just an order, an emergency order?
Absolutely, yes.
So
yes.
it's actually the law now in Florida?
Right.
All right. I appreciate that. Thank you.
Very good.
Mayor.
Thank you. Thank you, Commissioner Weiss, Vice Mayor Weinroth, and Commissioner McKinley.
Doctor, again, I thank you so much for bringing facts to us. I mean, the 7 of us represent over 1.5 million people, and each one of those people is looking to us for information, and obviously our email boxes are filled with people not only telling us what they're going to do, but asking for information. So these sessions, even though this last hour, sometimes I'd rather just move on to what I feel is the business at hand. I think this is very important because I think there are people that are looking to these sessions to get facts. And unfortunately, we have people there that will never take the vaccine. I'm so tired of watching the TV at night, seeing someone laying in a bed, dying, saying, I wish I took the vaccine. And I say to the TV screen, me too. So we're going to get through this, and I know that you've done everything you can to try and put the facts out there. I thank you. I thank you for bringing the information from the hospitals so we have a true idea of what's going on with our community. I just have one question. What about the flu season? How's that going to affect all this?
Well, I'm glad you mentioned that because I recommend that everybody get their flu shot. Please get vaccinated for the flu. It's a separate vaccine. They are working on a combination, but we don't have that yet. So the flu season's already started. The vaccines are available at the pharmacies. All the local pharmacies have them, and so step up to the plate and get your flu vaccine.
Thank you very much. And as I've said many times before, I'm looking forward to the day when we don't have to have these presentations. We go back to presenting proclamations and things like that. But thank you very much, Doctor.
You're very welcome.
Thank you, Vice Mayor Weinroth. Commissioner McKinley, then to Commissioner Marino.
Yeah, me too. I actually had pressed my button, Mayor, because I forgot to say thank you. I wanted to say thank you to Mary and to Todd and to the Healthcare District for last week was the first mobile vaccination that we had to our farm workers that are beginning to arrive back in the Glades community. And two of our farm work, our one farmer and then one that handles the staffing for a number of area farms both stepped up, and I look forward to continuing that as they start arriving back. So I just wanted to say thank you. But then I also had a comment about from Commissioner Sachs about people who have educated themselves and decided not to get the vaccine. And I want to thank Virginia and your public affairs staff and Mary and Dr. Alonso and everybody else. It depends on what you educate yourself with. If you're educating yourself with BS, and you've got people at the highest level of leadership, both in our state and our nation, that are not stepping up immediately and refuting that nonsense, that's what some people are educating themselves with. And so I want to thank you for pushing out factual, science-based, healthcare professional information as best you can to try to combat some of that nonsense that's out there. So thank you.
Thank you, Commissioner McKinley. We'll go now to Commissioner Marino, then to Commissioner Bernard.
Just to follow up on the flu shot versus the vaccine, is there a time frame between the two for efficacy?
We usually say 14 days so that your vaccine can go ahead and make its antibodies. So 14 days separated between the two.
Thank you.
Very good. Thank you, Commissioner Marino. Commissioner Bernard.
Thank you very much, Mr. Mayor. Dr. Alonso and Mary, thank you very much for this presentation. Earlier, you had mentioned the booster shot. Are we making plans in the county right now in regards to how are we going to kind of like work with our residents to get the booster shots to as many residents when it, not for the people who are immune compromised, but for the people who would need it later on?
We have added, we have what now, 6 sites with testing and vaccinating. And the side for the vaccinating is very low. A lot of testing, but the vaccination side is low. So they can go to any one of these sites and get vaccinated with the boosters once that becomes available. Right now, they're not doing that because it's not open yet for boosters, only for the immunocompromised. And also, the Publix has the Moderna vaccine to make available for either the 3rd shot or the boosters once it becomes available. And then Walgreens and CVS is handling the Pfizer. So vaccines.gov is a great site. It's vaccines with an S. .gov is a great site where you can put in your zip code and say how many miles away from your house you want to get, and it will tell you which pharmacies have the Pfizer or the Moderna, whichever one you're looking for, and whether they have it in stock or not. It's very easy, and then you make your appointment and you can get the vaccine.
Thank you. Follow up, Mr. Mayor.
Of course.
In regards to, you had mentioned typically you would get your booster shot within eight months of receiving the 2nd shot. We have a lot of our residents who probably received their 2nd shot in the end of January. When would those residents be able to potentially get the booster shot since they're kind of like running into that 8-month period?
Well, 8 months from January would make it September, and we're there now. So as soon as that becomes available, they were going to do it September 20th, but that hasn't been done yet. So I think they're holding back to make sure that, I don't know, what they're holding back for. I take that back. But they haven't approved that yet. So we got to wait until they make that decision.
And do you foresee a rush in terms of residents trying to get that booster shot? And are we preparing for a potential rush of residents trying to get that booster shot?
Yes, and I expect it'll be the same group. The seniors will definitely rush off to get their vaccines for the booster, and the others will follow. So that's why we added all these sites, which they're busy doing testing now, but they're not busy doing vaccinations. So anybody that wants vaccines, very easy right now to get vaccinated. A lot of places you can just walk in.
Okay.
And if I could just add, Commissioner, you know, the difference between where we were 8 months ago and now is this was a message just yesterday from the state, is that they're encouraging residents when boosters are available to go either to their private physician or the local pharmacies, because the difference between 8 months ago and now is they actually have a supply. There's, you know, sufficient supply of vaccines in the private sector, and there currently is no plans through any state resources at this time to roll out vaccines to public sites at this point.
Mayor, may I?
Please.
In addition, I do know that the clinics will be able to service their patients. We also have some of our other not-for-profit type federally
Qualified health centers.
will also have access to it, and they will also be vaccinating, providing the booster shot for their patients. We also have dollars within our ARPA funds for vaccines, et cetera. So if there is a gap, we'll be able to work with our health partners to make sure that all of our residents have an opportunity for the booster.
Very good.
Thank you, Mr. Mayor.
Thank you, Commissioner Bernard. All right, in closing, a couple weeks ago, I brought to the board's attention and to both Dr. Alonso and Ms. Blakeney the emerging technology on Q-tests and other rapid testing resources available to governments and large businesses. It has become apparent to me that the need and utility of those devices will increase dramatically. Regardless of whether it's imposed or mandated, it has become obvious that rapid testing and the ability to test within the confines of a building or an institution quickly is going to become very important and has been important. Are you aware of this technology, and have you had a chance to look at the veracity of that technology?
Yes, as a matter of fact, the state is using it. We're using rapid tests in the schools. The nurses are testing with rapid tests to do symptomatic children, and we're looking at all the different options to be able to do more rapid testing. There's no question it's the way that people are going to do it. People are doing it right now. The only difficulty right now is that for those tests that don't have a code or don't have an app that goes with it to identify who it is that's getting the test, those tests are not being reported into the Florida SHOT system, into the Maryland system, and so we can't verify those. So we need to have, and we're working, DOH is working with the vendors to make sure that that occurs so that those can directly go into our Florida system so that we can count that as a test. That's very important that get recorded.
For sure, it's important that the data is collected, but the concern, any concern you have is not related to the veracity of the technology or the testing itself.
No, not at all. I mean, that's the way to do it. That's the way to do it in the future.
Very
We'll
good.
have it at home. This is going to be around, you know, these viruses do not go away. I want to emphasize that. H1N1 is still circulating. It's going to be in your flu vaccine. So this COVID will continue to circulate in the world. It does not disappear.
All right, Commissioner Bernard.
Thank you, Mr. Mayor. You had mentioned the Q testing. My question to Administrator Baker and to staff is, since COVID's impacted the workforce, what are we doing in terms of making sure that we have Q testing available for our workers, our employees, and our workforce?
if I, just so I'm clear, when you say, you mean just the COVID testing? Is that
No,
what?
Just to be, it's more of having the ability to get the results in a,
Timely manner.
30-minute period, so in that way it can reduce the amount of days that our employees are out.
I reach out to my partners, which is the Department of Health, that we work with to get our employees tested. In addition, we also had a contract, and I think that is something that we're looking at with one of the vendors here in Palm Beach County, so we can get a rapid response back to the testing. So we have not had an issue with that particular problem. If we run into that issue, then we will expand the users that we have. For the most part, it's been turning around. There was a backlog from the labs, but I think that has pretty much cleared up. And so within 24, 36 hours, we're able to get responses back.
Follow up, Mr. Mayor?
Please.
You mentioned like maybe a 24 to 36 hour to get a response back, but if you do a Q test where you can get a response within 25 or 30 minutes, why wouldn't we proceed with that method?
That is a method, and I'm not a doctor, but we've had issues where some of those quick tests come back negative. They give a false negative, and then they're tested again because then symptoms come on or symptoms continue. They get a PCR, which is more, I think, reliable, and then that's when it comes up positive. So as technology continues, as we've all learned, and I think the vendors are going back and reviewing what they're doing and making tweaks, I think that in the future will definitely be the way to go. It's just been our experience in the past that we've had those particular issues, so we've required the PCR.
Mr. Mayor.
We had a conversation last night about that as physicians, we treat patients, not test results. So it's very important that with every test that you do, you take into consideration what the patient is presenting with. And there was an example given about a hospital admission where the test kept coming back, the rapid test kept coming back negative. But it looked like COVID, it smelled like COVID, it was walking like COVID. So the doctor was pretty sure it was COVID. So until they did the PCR, then it finally came back positive. So the PCR is going to be always the gold standard because of the way it's done and what it actually tests for. The rapid tests are good for screening and for doing things rapidly. So there'll always be that standard in the case where there's it doesn't look right.
I agree with you, and I just think that we should use every tool in the toolbox, so in that way, if it's to get a screening, if there is an outbreak in one of the county departments or something, at least we can actually get a testing done as quickly and as efficiently as possible, and then we can always follow up with the PCR.
And the technology is getting better and better. So I agree with Ms. Baker that as that technology improves, the vendors will automatically want to do it more quickly. And so that will be the way it will be done in the future. It will continue to improve and become, it's just like a pregnancy test. In 15 minutes, the little line turns blue or it doesn't. So.
And so you said that the state is using the Q testing right now, am I correct?
Yes, there are certain counties that are using that. We're still using BioNX in the schools.
Okay. I know, Mr. Mayor, I know for me, I'd love for us to be able to use that toolbox if it's available, for our workforce.
Very good, and I appreciate the support on this, Commissioner Bernard. I've gently suggested and tried to turn administration's attention to this issue. It seems like there is a little bit confusion, because my understanding, and this was asked directly of Dr. Alonso, and the administrator responded that she didn't have full confidence in this test, but my understanding is the Q test is a PCR test, and that it was mentioned earlier that we've utilized this technology and there were false negatives or positives, but I'm not aware that we've been using the Q test in our unit of government. So I definitely need some clarification on that. It doesn't have to happen right now, but I would like a further investigation and now a little bit in more formal context report back to this board on what technologies we can utilize as we embrace some of the more expanded testing mandates that come down from the federal government. What I take away from this is that we've been looking at it, there may be some confusion, but I want to cut through that confusion and have some precise data delivered back to the policymakers of this county. And one of those issues that I'd like to be looked at with more formality at this point, and Commissioner Bernard is joining me in this, is the Q test that is available, robustly available, utilized by the state, utilized by other counties, and based upon Dr. Alonzo's and my research, that there should be no concern about the veracity and accuracy of this new technology. I think it can be very powerful for our unit of government as we contend with either further mandates or guidelines by the federal government. Commissioner Sachs.
I absolutely agree. We've
All
got
right,
to
well,
do it. And we need to start here in county government, and maybe it'll roll over into in school district and other
Absolutely, and it looks like the
areas of
board is
government. It's
forming
very good.
a cohesive perspective on this issue, so I think it's incumbent upon administration to take these suggestions seriously. Not that you haven't been, but I do think that there's a collection of commissioners that are excited about the options available to us moving forward so that we can continue to participate in an effective and efficient government in the way that it's run. Madam Administrator.
I have no problem with that, Mayor, Commissioners. I have had these discussions with Dr. Alonzo, and I was attempting to follow the science, and right now that is exactly what we were doing with the PCR. I believe in toolboxes and using all the tools necessary to keep us safe and healthy in this environment so we can carry out our functions. If there are, no symptoms, et cetera, and I'll continue to work with Dr. Alonzo, I can understand that. If there are symptoms, then we probably ought to follow through on the PCR test as well.
Well, and we just also have to recognize that the Department of Health is responsible in part for the whole of the county's population, but when it comes to internal testing within our government, it's a horn of the bull that you need to grab, because we're not going to be able to rely on outside agencies to assist in our internal decision-making processes and resources available to accommodate the regulations and guidance that come down from the federal government. And I'll just leave it at that and close by saying that this has been very challenging. We all are aware of that, but it's not lost on me, not just as a county commissioner or county mayor for this moment in time, but as a resident of Palm Beach County, that we consistently outpace the rest of the state and having a lower positivity rate, higher rates of vaccination, broader and more accessible resources to our constituents, whether it be testing, vaccination, monoclonal antibodies, what have you. And so there's a lot to be proud of here in Palm Beach County, and that is a direct reflection of the awareness and commitment by members of the public to keep our communities and neighborhoods safe, and I'm very appreciative of that. And so I think that the community will continue to keep up the good work, and I appreciate your time here today, both of you. Thank you very much.
Thank you.
That will conclude agenda item 4B and special presentations as a whole. Agenda item 5, there are no public hearings published and noticed for today. Do we still need a motion to receive and file proof of publication?
Second.
Motion by Commissioner White, seconded by Vice Mayor Weinroth to receive and file the proof of publication, reiterating that there are no public hearings. All in favor? All opposed? That motion passes 7-0. We'll move now to the regular agenda, which is found and starts on page 86 of the published agenda, 6A1, County Attorney's Office, motion to commence private attorney-client session.
That's at 1 o'clock.
Mr. Audi, you recognized.
Mayor, Vice Mayor, Commissioners.
Is your microphone on, sir?
Morning. All right. Yeah, so good morning again, Mayor,
Good
Vice
morning.
Mayor, Commissioners. Staff recommends a motion to commence a private attorney-client session in the case of In Re National Prescription Opiate Litigation, case number MDL 2804, Northern District of Ohio, and Palm Beach County versus Purdue Pharma et al., Case number 1:18-OP-46121-DAP, Northern District of Ohio. During the Board of County Commission meeting today, September 14th at 1 p.m. in the McKeedy Conference Room, 301 North Olive Avenue, 12th floor, West Palm Beach, Florida. The following persons will attend: the County Administrator, Virginia Baker, County Attorney, Denise Marie Neiman, County Attorney Designate, Denise Kaufman, Chief Assistant County Attorney, David Oddie, and our outside counsel. From the outside counsel, we have Shayna Sachs, who will be making a presentation, and James L. Ferraro. Pursuant to Section 286.011, subsection 8 Florida statute, the entire attorney-client session shall be recorded by a certified court reporter who shall record the discussion and proceedings, the names of all persons present at any time, the names of all persons speaking. No portion of the session shall be off the record. The court reporter's notes shall be fully transcribed and filed with the clerk and shall be made a part of the public record upon the conclusion of the pending litigation. The discussions will be limited to settlement negotiations of the aforementioned cases.
Very good. Are there any questions by members of the board? Commissioner Bernard, you're recognized.
Thank you, Mr. Mayor. I think that, David, you had skipped that the members of the Board of County Commissioners would be present. Do you still want us to be there?
Yes. I blame that. In addition to the Board of County Commission, we can't have it without you. Okay.
Very good, and by way of a reminder, this is related to a very important issue in litigation that was brought to this board by and under the leadership of Commissioner McKinley, related to the opioid epidemic and compensating local governments for the resources we've expended in assisting our constituents. So there is a motion to commence at 1 p.m. this private attorney-client session made by the Vice Mayor, seconded by Commissioner Marino. No further comments. All in favor, all opposed. So that motion passes 7-0, and the board will meet in that shade meeting at 1 p.m. promptly. That concludes 6A1. We'll go now to 6B1, airports, regarding a one-time purchase of a 6x6 high-reach extendable turret aircraft rescue fire apparatus. That sounds
Mr.
really
Mayor?
cool. Yes, sir.
Yeah, the next two items, 6B1 and 6B2, ordinarily would be on a consent agenda, but for the fact that they are over $325,000, which requires that it be on the regular agenda. For that reason, I'm going to move 6B1, which is the high-reach extendable turret aircraft rescue and firefighting vehicle, for approval.
Do we have a picture of it? Oh, sweet. Oh, that looks cool. And for those commissioners that haven't taken a ride with the fire rescue division at the county, Palm Beach International Airport, and haven't ridden in that truck, I would recommend it. It's really a fascinating piece of equipment. That tip, as far as I recall, goes into the body of the aircraft, and it's just really amazing technology. So I would go for it. We have a motion by Vice Mayor Weinroth. Is there a second? Commissioner Sachs, do you have any comments, Commissioner?
It's really a question, if I may ask the
Please.
staff. Thank you very much. Thanks for all the good work you do. My question is this. This amount of money that we're spending on 6B1, and also on 6B2, are any of the funds coming from the federal government, since it is an airport? And secondly, are any of them coming from COVID funds from the federal government?
So the fire truck is being purchased solely with local funds?
I'm sorry, I didn't hear you. The aircraft rescue and firefighting vehicle?
Yes, that's locally funded. In addition, the janitorial services contract, it is primarily being locally funded. However, a portion of that is being reimbursed by the TSA. For fiscal year 2021, it's about $278,000. I do believe that they're likely to extend that reimbursement as well.
So, to recap what you said, the first item is being purchased solely by county funds.
Airport funds.
Airport funds. Thank you. Okay, that's good. And the second, we are getting reimbursement from.
We're getting reimbursed a portion of that through the TSA. I mean,
Nice job.
we are eligible to use our CARES Act funds and other federal funding for the janitorial services contract. We've elected not to reimburse from that contract and to reimburse other costs. Primarily relates to our rate making with the airline agreement.
And said another way, even though they're airport funds, that's enterprise funds, they're
Yes.
not ad valorem funds.
Yes.
Very good. So the motion's been made on 6B1 by Vice Mayor Weinroth and seconded by Commissioner Sacks. I don't see any further comments by members of the board or public comment. All in favor, all opposed, that passes 7-0.
Yeah, Mr. Mayor, if you would allow me to move 6B2, A, B, and C, the janitorial contract again over the $325,000 threshold.
Very good. Commissioner Weiss, you recognized in comments?
Thank you, Mayor. Just a question for you. Is there a policy in place regarding the wages that are paid on that contract? Or those workers?
So that agreement is not subject to the living wage ordinance. However, we are incorporating increases of 50 cents across the board for all of the employees. When we do reissue this contract, we will include a living wage provision, although it's not required by the living wage ordinance, because we do envision that we will need to get up to $15 an hour minimum across the board for all of the employees.
All right, thank you.
Very good. Does that include a second to the motion made by Vice Mayor Weinroth? We have a motion by Vice Mayor Weinroth on 6B2, A, B, and C, and seconded by Commissioner Weiss. There's no further discussion. All in favor, all opposed. 6B2, A, B, and C passes 7-0. Thank you very much, Laura. We'll move now to 6C1, Housing and Economic Development. Regarding
Mr.
the
Mayor,
resolution. Yes, sir.
in regards to item 6C1, I'd like to make a motion to adopt this item and to state also that neither the taxing power nor the faith and credit of the county nor any county funds are pledged to pay the principal redemption premium, if any, or interest on the bonds.
Second.
Motion by Commissioner Bernard, seconded by Vice Mayor Weinroth on 6C1. It's a motion to adopt a resolution by the board. No public comment. All in favor, all opposed. 6C1 passes 7-0. We'll move now to 6C2.
Mr. Mayor, in regards to item 6C2, since we did have a workshop, I believe last month from the BDB, I would make a motion to approve this item and to also state that these are county ad valorem funds.
Second.
A motion by Commissioner Bernard and seconded by Vice Mayor Weinroth on agenda item 6C2, a motion to approve a contract for economic development services with the Business Development Board. There's no public comment or comments by members of the board. All in favor, all opposed. 6C2 passes 7-0.
Mr. Mayor, in regards to item 6C3, I'd like to make a motion to approve items 6C3A, B, C, and D.
We have a motion by Commissioner Bernard and seconded by Vice Mayor Weinroth on 6C3, A, B, C, and D relating to Housing and Economic Development Home Investment Partnership Program. There's no comments by members of the public or comments by members of the board. All in favor, all opposed. 6C3, A, B, C, D passes 7-0. Thank you. Commissioner McKinley, you're recognized.
Yes, thank you, Mayor. Our next item is item 6D1. I need to disclose a voting conflict on this item, the adoption of a resolution establishing a non-ad valorem special assessment within the county's limits pursuant to the Palm Beach County Local Provider Participation Fund Ordinance. I sit on the Board of Trustees for Palms West Hospital. While this position is unpaid, I've been told by the County Attorney's Office that it would be a conflict for me to vote on this agenda item. In order to comply with the Code of Ethics, I will abstain and not participate in any discussion regarding this matter.
Very good. We have received a copy of Commissioner McKinley's Form 8B, and she will not participate in deliberation or voting on 6D1. We'll turn it over to Ms. Nancy Bolton and Mr. Todd Von Lehren, Assistant County Administrators.
Good morning, Mayor and Commissioners. This item is the last item that staff will present to you this year on this issue. We are requesting a motion to adopt a resolution establishing a non-ad valorem special assessment within the county limits pursuant to the Palm Beach County Local Provider Participation Fund Ordinance, which was adopted by the board on August 26th. For the purpose of benefiting assessed hospital properties through enhanced Medicaid payments for local services, and also to approve an interlocal agreement between the county and the Healthcare District of Palm Beach County for the provision of administrative coordination of the special assessment authorized by the Local Participation Fund Ordinance. Does the board require a background on this issue?
I think we have been sufficiently briefed on the background, and we're going to hold you to your representation that this will be the last time you're presenting on it.
This year.
Although we're delighted to have it before and pending before the board. Are there any initial comments or questions by members of the board before we turn to public comment? Very good. Commissioner Bernard, you're recognized in public comment.
Thank you, Mr. Mayor. We do have 3 comment cards. The first one will be Mr. Don Chester, and the other 2 are Ellen Bogdanoff and Charles Lubin, but they're only available for questions.
Very good. Thank you, Mr. Chester, for being here today, and you'll be recognized for 3 minutes.
Mayor, Vice Mayor, Commissioners, I just want to take again this opportunity to thank the staff, especially Virginia Baker, Nancy Bolton, Todd Bunlaren, and I'm going to miss Helene Zvid. I can't believe I did that. For all of your work and your efforts to get this done, and I would consider to be record time. And it's a tremendous benefit to the hospitals in our community, and we thank you very much.
Very good. That conclude comments by members of the public. I don't see any questions for the other 2 public speakers that submitted comment cards, so we're in deliberation.
Mayor, I'll move 6D1 for approval, noting that no county funds are required.
Very good. We have a motion by Vice Mayor Weinroth on 61A and B. Is there a second? Second by Commissioner Weiss. I don't see any further comments by members of the board. All in favor? All opposed? The item passes 6-0 with Commissioner McKinley abstaining. Very good. We're now on 6, and thank you to Todd and Nancy and Virginia and all the hospital administration for their great work on this very important agenda item.
Mr. Mayor, as soon as the commissioner returns, I'm going to make a motion to approve 6D2. We've all been briefed on this item, and I think we're all in agreement, or we are in agreement that we have the information we need to make a decision on this.
We can take that motion up. I just wanted to update the board as I was directed by the board to enter negotiations on with the administrator on this item. And I just wanted the board to consider a different perspective. I think that what we've been briefed on and what is published in 6D2 is certainly fair to a certain degree. I wanted the board to consider my personal perspective. This is going above and beyond what is before the board, and that's mostly because Ms. Baker is very humble and sometimes maybe unwilling to advocate for her own interests, but I will. And I've had a front seat to her management and leadership style and effectiveness over the last 2 years. I believe that she entered this position prejudiced in a way by her contract, that it wasn't fully cognizant of her abilities and skills. While certainly the board can do whatever it wants on this agenda item, I would ask that the board consider, and this is of my own volition, and I'll take the heat for it, but I do think that her contract wasn't fair to begin with, and that she has worked and managed and led in a way that should humble this board and the constituency of Palm Beach County at large. And what I would ask the board to consider for a moment is, in addition to the agenda item before us that's published, also consider a 5% raise that would be effective on today by the passage of the board if that motion is made part of it. I do think, and I'll back this up in any way, and I'm proud to do it, I think the board should consider a 5% raise that starts today in addition to the other items for the renewed contract that would begin in October, I think, or September of 2022. I think that 5% doesn't fully compensate her for the work and effort and dedication she's put into her leadership and governance of this county, but I think it's a start. Commissioner Bernard, you're recognized.
Thank you very much, Mr. Mayor. I want to thank you for bringing this up and also for leading the negotiation with Ms. Baker. I do support doing the 5% immediately. I've had the chance to take a look at the 2021 County Administrator Salary Survey, and looking at it, I do realize that Ms. Baker's gone above and beyond in terms of what we've asked her and what she's had to deal with in the past 2 years, also dealing with the pandemic. And so I do support doing that, and so I would make that motion which the motion would be to amendment number 2 to the employment contract, and also to include the 5% raise immediately. Thank you.
We have a motion by Commissioner Bernard, as stated. Is there a second? Commissioner Weiss has seconded that motion. Commissioner Sacks, you're recognized.
Thank you, Mayor, for making that proposal. And I, reviewing what this year has been, and I'm one of the newest members here, but this has really been an extraordinary year. And sometimes people rise to that, to those crises and to those challenges, and I have to say that our administrator has done that beautifully and seamlessly and with a lot of grit and grace. And I certainly support your proposal today. And I think that we owe her a great debt of gratitude on our behalf, on the staff, as well as the people of Palm Beach County, for what she's led so well this last
Very well said. Thank you, Commissioner Sacks. And I think it's important to note that this is in no way prejudicial to the larger workforce of the county. In fact, the county administrator has pushed very enthusiastically the Evergreen study, which has yielded inequities and, well, I'll just say inequities in the way the larger workforce has been compensated, and this board reacted very quickly to ensure that we raised the salaries to a more meaningful level for the workforce at large. And I appreciate the comments being made today in support of my additional consideration to Ms. Virginia Baker. Are there any other comments by members of the board? Commissioner Marino, you're recognized.
So just for clarification then, when we are approving the 15% for next year, it would actually be based on a salary of $322,000, not on a salary of $304,000.
I don't know what that specific, I didn't do the math, but it would be 5% effective today and then a 15% effective at the expiration and renewal of her contract.
Okay, does it need to be clarified or just the percentage is enough?
Percentages
Okay.
are enough. So the motion
Thank you.
pending is for, in addition to what has been published, an additional 5% raise effective on today's date if the board passes the pending motion. Further questions or comments by members of the board? Motion's been made by Commissioner Bernard, seconded by Commissioner Weiss. Commissioner McKinley recognized.
Just a little color commentary. I'd love any time. I love some Vince Long up in Leon County, but it's a much smaller county. And in comparison, when you look at that salary study, to see what the salary is there versus here, it certainly makes sense to compensate our county administrator for the job at hand, managing more than 6,000 employees in a county of 1.5 million, plus all the visitors that come here. It's certainly warranted. We get a lot of pressure to operate county government like a business, and no CEO with that kind of responsibility would be making a salary as low as what you were making. And so thank you, Mayor, for making those adjustments today.
Thank you, Commissioner McKinley. And I hope that despite the fact that not many words have been spoken today, that this is a recognition and a deep appreciation of your leadership, Madam Administrator. So the motion has been made and is seconded on 6D2. No further comments. All in favor? All opposed? Passes 7-0. Madam Administrator, you're recognized, and congratulations. And we're delighted and excited to have you, I hope, for another 5 years.
I don't get speechless often, but there. First, let me thank the board. Thank you for your leadership. your devotion, your answering my calls late at night, weekends. I do appreciate it. We could not do what we do for our residents without your leadership. And a special thanks to my staff, Team PBC, because none of this would have been accomplished without their assistance. They rose above and beyond the salary adjustments that were made through the Evergreen study, which the second phase is October 1. This third phase will be hopefully next year if the budget will allow it and the board approves it. But they have earned every cent of it, and they work hard. And my management team, thank you very much. And my budget folks, they're the best. And again, it's all of us, from our guys in the road and bridge, our signal guys, our community service that provide services to our community groups, the people that need the help the most. I cannot say thank you enough. And a special thank you to the county attorney's office, Ms. Denise Neiman, Marie Neiman, that's going to be unfortunately leaving us, but also Denise Kaufman and David. Thank you very, very much, not only for working with me on the contract, but also our litigation. And I think the county attorney's office also very much. So thank you.
Well, now that we have you contractually bound for another possibly 5 years, I ask that we join in giving Ms. Virginia Baker a well-deserved round of applause. All right, well, thank you for your indulgence to the members of the board. I don't want to push my luck, but if we could take a 5-minute recess before we take up agenda item 6E1, I would be very thankful. So we'll be in recess for 5 minutes. in the commission chambers. We'll take up agenda item 6E1, which we do have public comment on, and this is in relation to risk management term contract for insurance brokerage services. All right, good morning, Nancy.
Good morning.
You're recognized, and if you could introduce your team.
Good morning, Mayor and Commissioners. During the last board meeting, the board requested staff return with this item, which is staff seeking a motion to approve a new term contract for insurance brokerage services with Arthur J. Gallagher Risk Management Services for the term 10/21 through 9/30/22 with 4 12-month renewal options. The contract allows the purchase of insurance policies, including but not limited to airport liability, excess property, excess liability, and excess workers' comp, as well as other ancillary policies for specialized exposures. Here at the table with me, I have the Director of Purchasing, Kathy Scarlett, Director of Risk Management, Scott Marding, and our Assistant County Attorneys, Annie Helfont and Helene Vizd. They are here because this was an RFP, and Kathy is here to speak to the process, and staff has prepared a presentation for the board's consideration regarding the process that staff undertook to come to this conclusion. If
Very
it's your
good. We'll look
pleasure.
forward to the presentation.
Thank you. If it's okay, I'm going to remove my mask because
Sure.
I'm
The assistant hearing you, so it's
yeah,
allowed.
my glasses are going to fog, so thank you. On April 5th, 2021, a solicitation for insurance broker services advertised as RFP 21-040 was advertised. The solicitation was posted for 1 month ending at 4 p.m. on May 5th, 2021. This presentation is being made to support the selection process and subsequent unanimous recommendation to award RFP 21-040 for insurance broker services to Arthur J. Gallagher. The purpose of the RFP was to solicit proposals from qualified insurance brokers to market and place all of the county's commercially purchased coverage and to provide other insurance services to the county as are customarily performed by a commercial insurance brokerage firm. The RFP was issued under the general provisions of County Code Sections 2-2 through 5 through 2-58 of the Purchasing Code. In addition to the purchase of coverages, the selected broker will also work closely with the Risk Management Department to determine the county's insurance needs and direct the self-insured retention program. 3 brokers submitted proposals. They were Aon, Arthur J. Gallagher, herein referred to as AJG, and Brown & Brown, who does business as PRIA for the purposes of this contract. Aon Risk Services was subsequently deemed non-responsive for failure to meet the MWBE goal of 5%. The selection committee for this RFP was made up of 5 members. 3 of the 5 have an extensive background in the risk management and insurance industry, and the 2 others are considered experts in their respective fields. The team members were Nancy Bolton, Assistant County Administrator, Scott Marding, Director of Risk Management, Tanya Davis Johnson, the Director of Office of Equal Business Opportunity, Lisa Pontus, the Director of Office of Management and Budget, Jacqueline Benz, the Property and Casualty Insurance and Claims Manager for Palm Beach County. The selection committee held 2 separate meetings. Meeting 1 was on May 24th, and meeting 2 was on June 4th. These meetings were open to the public in accordance with the Sunshine Law. While there is no requirement to do so, proposers are welcome to attend the meetings as audience members. Our experience with these types of procurements has been that vendors' attendance at the public meetings is mixed. Some do attend and some do not. In addition, at the first meeting, all audience members are given a brief opportunity to speak if they choose to do so. At this meeting, no one chose to speak. During meeting 1, the committee conducted an extensive review and discussion of each proposal, but required additional clarification regarding the wholesale and intermediary commission percentages proposed by Arthur J. Gallagher. Purchasing staff advised the selection committee that additional information could be requested and is an allowed procedure under the RFP, and the selection committee voted to request written response to its questions and reconvene on June 4th after the purchasing department had obtained clarification. At the second meeting, we finalized discussions regarding the outstanding items, and the committee determined we had sufficient information from the submitted proposals and attached an additional submitted clarifying documents with which to calculate our evaluation scores to determine which vendor would be recommended for an award. Oral presentations were not deemed necessary by the committee due to the comprehensive nature of the information contained within the proposals. In the RFP process, it is not uncommon for a selection committee to move directly to scoring based on the proposals themselves and not advance to oral presentation. After the scores were tallied, the result was unanimous by a vote of 5-0 that the recommendation to award the contract to Arthur Gallagher would be moved forward. The recommended award was posted on June 9th, 2021 by the Purchasing Department. The RFP included the following language in Section 2.9 regarding the right to protest a contract award, which is consistent with the County Purchasing Code, Section 2-55. It says, any proposer may protest any recommendations for contract award by submitting a written protest to the Director of Purchasing within 5 business days after posting the notice of intent to award in accordance with Chapter 2, Article 2, Section 2-55 of the Palm Beach County Code. Protests must be submitted in writing, addressed to the Director of Purchasing via hand delivery, mail, or fax. No protest was filed citing any of the concerns relayed to the Board of County Commissioners in a written memo sent to the BCC with a copy to Purchasing yesterday on September 13th. The evaluation criteria for the RFP consisted of 7 components. Broker experience, qualifications, background, and references was 20 points. Team leader experience and qualifications was 15 points. Service team experience and qualifications was 15 points. Approach to servicing the account was 20 points. Additional services was 10 points. The price proposal was 15 points. And the business location and local preference was 5 points. We're going to break down each section of the 7 qualifications that we scored on individually now. And the first one was broker experience, qualifications, and background and references, which was 20 points. In this section, Arthur J. Gallagher scored an 86, and Priya Brown & Brown scored an 80. Arthur J. Gallagher indicated 94 years of industry business, while Priya indicated 82. Both have a large public sector presence and strong references, although it should be noted that the majority of county governments represented by Brown & Brown have populations of less than 500,000, with the largest being Lee County with a population of 800,000, as compared to Palm Beach County's population of 1.5 million, with corresponding premiums reflecting programs about half the size of Palm Beach County's program. Arthur J. Gallagher is the broker for similarly situated counties to Palm Beach, including Broward, Miami-Dade, Hillsborough, and Orange County. As far as broker rankings, Arthur J. Gallagher is ranked 4th largest broker in the United States, and Priya, which is Brown & Brown, is ranked 5th. It also is worth noting that Aon, who also bid this, is the 2nd largest broker in the United States. So we did have a very large, although we only had 3 respondents, they were very large brokers that have a lot of business within the United States. So that's worth noting. For team leader experience and qualifications, it was for 15 points. In this section, Arthur J. Gallagher scored a 67.5 and Priya scored a 58.5. Both proposers indicated very strong team leaders. Arthur J. Gallagher proposed Judy Arns, who has a CPCU designation, which is considered the most academically rigorous designation in the carrier world, with 49 years of experience in the insurance industry and is based in Boca Raton. Priya proposed Michelle Martin as the team leader, who has her certified insurance counselor designation and 30 years experience in the insurance industry and is based in Daytona Beach. Moving on to the service team. The service team experience and qualifications was for 15 points. Arthur J. Gallagher scored a 64.5 and Priya scored a 57. This slide shows the Florida-based team members proposed by each. Both of the groups had fairly large team members, so we confine this to Florida when looking at for the presentation purposes. The yellow highlight is used to highlight the team members located in Palm Beach County. It should be noted that Arthur J. Gallagher has 86% of their Florida-based team serving our account located within Palm Beach County, which is 12 out of their 14 members. Priya has 7 out of their 14 members, which was 50%. We also factored in the total years experience of the proposed team members. Arthur J. Gallagher has 339 years of combined experience. Priya had 185 years of combined service experience. Next, we move on to the approach of servicing the account, which was 20 points. Arthur J. Gallagher scored an 84 and Priya scored a 76. While only 8 points separated the scoring, each proposer had different approaches to servicing the account. Arthur J. Gallagher would maintain the current strategy, but submitted several options for us to consider at the next renewal. Priya would change the strategy, attempt to reduce our self-insured retention, and work to negotiate each market separately. The next was additional services, which was for 10 points. The scores were Arthur J. Gallagher 41 and Priya 36. Both provided value-added additional services, some of which were applicable to what we do and others were not. Then we moved on to price. Price was worth 15 points. Priya submitted a lower price by $10,000 and was scored accordingly by the selection committee. Arthur J. Gallagher scored a 51, while Priya scored a 61.5. Wholesalers and intermediaries were similarly priced at a not to exceed a 6% or a 4 to 6% commission average, respectively. Arthur J. Gallagher currently, through their placement on our April 1st renewal, had an average intermediary commission of 5.5%. Next, we moved on to business location. Both of the proposers have offices within Palm Beach County, and both were given 5 points. The final scoring had Arthur J. Gallagher at 419 and Priya at 394. The important note here is that it was unanimous of 5 to 0 in favor of Arthur J. Gallagher. Also, the scoring, the points could be even 1 point apart. But at the end of the day, the way it's scored is you award a first place and you award a second place. And if there was a third, it would be a third and so on. So the vendors either got a first place in this case or a second place ranking. And the rankings for this particular selection committee were unanimous at 5 to 0 with Arthur J. Gallagher having first place. Also, you'll see a final breakdown just to give you an idea on what the scorings were, because I mentioned a 419 to a 394. This just gives you a breakdown of each of the 7 areas and what the actual scores were. At this time, that concludes our presentation. We're happy to answer any questions you may have.
All right, we'll go into questions to the professional staff. Commissioner Weiss.
Thank you. In this, I guess, when I was looking through the proposals that you provided to us, and I have to say a couple things that stood out to me. It looks like, does our data not reside then in our systems, that this goes on to our, goes into the systems of the providers? The data for our statement of values or It looked like the systems that we're utilizing are not our own systems, that
Sure.
we work on their systems, so it would be our data that's going into their systems. Is that
It
correct?
depends on what it is. Some of the data is most of the stuff is managed outside, yes. Like, for example, our appraisals are through a company called American Appraisal. The data is housed there. Our statement of values, we get a copy of it. It's basically, we maintain that, but we do share that information with them. As our current program is set up, Gallagher does have the ability to house everything that we have, but it's part of a bigger process. We also have a third-party administrator for both workers' compensation and property and liability, which, by the way, both of those are Brown & Brown. So we use their databases, and I think that's always been the struggle in risk management, is it's so big and there's so many different things we do that it's very difficult to have one centralized database for everything. We're trying to work towards that, but in most likelihood that will not be a county database.
So I forgive me if I missed it, but I didn't see any requirements in terms of reporting on breaches that they may have or exposure. The ability to recover our information and things like that. And it's, to me, I thought that was sort of glaring, that.
Sure.
Because I know the efforts that we make within our own systems, and so in terms of how you look at, and I know you're looking at a lot of different things, but that stuck out to me. Is there any reason why you all don't look at that or consider it, or?
We do. I think it depends.
Where does it show up?
Okay, it depends on what the data is. For example, in Gallagher's proposal, you're going to see, and boy, I can't put my finger on exactly where it is, but Gallagher has several different programs. One of them is called
360 Core?
There's the 360 Core, and then there's the eRisk Hub.
Right.
And that has some of that information in there. We work very closely with the different vendors. For example, our biggest concern, honestly, from a risk management standpoint, isn't even this. It's the health insurance data. And we do have specific stuff into that. And we do, I believe, ask for particular coverages that we require the vendors to keep to protect us. So I don't know if that fully answers your question. I do have Jackie Benz, who's our property and liability manager, here to answer questions. She may be able to give you more specifics. I don't know if you want to step to the podium, Jackie, to address that issue.
Let's see, how do we turn this on? Oh, it's on. Morning, Mayor, Vice Mayor, Commissioners, County Administrator. As far as our systems, the data that we have, if you're referring to the insurance broker contract, is mainly just at renewal time. That data is all our own data, and then we send it only at the time of renewal. And then they compile it in their system and do something with it. This is not information that is long-term in their system. As far as the claims data that Scott Marting alluded to a minute ago, that claims data is kept in a claims system. Again, our contracted party is Brown & Brown for those, and they do have a security system in place to prevent, any breach of system. As far as explaining it to you today, I was not prepared to explain it to you today, but I would be happy to get that information to you.
I would just think that, as you're looking to, to qualify these folks, that would be something that would be up for consideration, and how, and what that liability, I mean, it's just another liability that we would potentially have, and so how that's being managed, and then again, going back and looking at, as we know, I mean, cyber is gotten obviously a lot of attention, but cybersecurity, and is there an obligation for them to, because right now there's no obligation to report to anybody if systems are breached, and would that make sense in our contracts with whoever is servicing us, that since our data is now residing on their systems, that if in fact there is a breach, that they have a requirement to report that back to us and within a certain period of time? And whether they have that ability or capability or even the interest to want to do that, because as we know, a lot of companies, they'll pay off the ransomware attack, not say a word to anybody, and just go about their business without alerting anybody. to the potential impact, because once that data gets out there, God, you just don't know where it's going to go. So that was one of my questions. And then on the area of commissions, it said it was $295,000 a year maximum, plus 6%, but there's no other marketing dollars, no other fees, nothing else that can transfer between these parties without our knowledge?
That's correct. That's correct.
So do they sign an affidavit?
Well, they signed an affidavit when they submitted their proposal, and they give us, we have the ability to audit, any information, and they give us a monthly or an annually rundown when they do our renewals. For example, we just had our 10-1 renewal, our 4-1 renewal, and we got a breakdown of all the commissions that they were paid. And that's in the old contract, but there is a true up also. So any commissions they exceed over $295,000, they give us that back if it's their direct replacement. And the last time I checked, they were at about 301. So we do expect a payment back from them, and we do verify that through a true up process.
Okay, thank you. All right, thank you, Mayor.
Thank you, Commissioner Weiss. Commissioner Bernard.
Thank you, Mr. Mayor. Just, Scott, I'm going to page 5, if you can kind of go back and kind of explain to me what happened between meeting 1 and meeting 2. I think you mentioned there was additional information that was needed. If you can clarify that for me, please.
Absolutely. There was 2 questions that were asked. One of them had to do with we had requested a database that we could potentially use for safety-related items and loss control-related items, where maybe we could put everything together to be able to give. We have a lot of different databases, and the goal was to find something that might work to put everything together. We weren't necessarily clear from Priya's proposal if it was included in the price. And then the second question that was asked was pertaining to Gallagher, which I just mentioned earlier, where there was some question about their intermediary and wholesale commissions. So when we did ask the question, it was also determined that on page 81 of their proposal, they did have those numbers, and they did quantify that they were going to be an average of 6% or less. So it was already in the proposal, but it gave us the chance. We wanted to make sure we were thorough and transparent, so it gave us the opportunity to kind of take a step back and make sure that we had all the information we needed to make the decision, but it was already there.
Okay. Thank you very much.
Yes, sir.
Further to those 2 meetings, one on May 24th, who attended those meetings from outside of the county's ambit?
I don't have the roster in front of me. As far as our selection committee goes, and obviously there was a few folks from purchasing, Donna Pagel, who ran the purchasing as the, I guess you would call it the MC of the event type of a thing. She's the one who kind of runs it on behalf of purchasing. Megan Davis is her assistant. She was there.
Outside of the county's ambit?
Outside of the county, I would have to look at a score sheet. I do know that Brown & Brown was there. I don't know who was there at meeting 1, but I do know Brian Cottrell was there at meeting 2.
Who's Ryan Cottrell?
Brian Cottrell is I'm sorry, Brian. Yeah, he works for Brown & Brown, Priya.
Okay.
He's listed in the proposal as
Right.
our backup, local backup.
Is it Ryan or Brian?
Brian with a B.
Brian, so Brian was on behalf of B&B, or Brown & Brown, and then, or we'll call Priya, and then was there anyone on the side of Gallagher?
No, sir.
And then what about at the June 4th meeting?
June 4th was actually Brian Cottrell. The first meeting that we had was a young man. I don't know who he is. He was with Brown & Brown, that was clear, but I don't know who he is.
I should have been more clear. I don't need names. I'm just wondering.
As far as vendors go,
Yeah.
Brown & Brown attended both meetings, and Arthur J. Gallagher was not present at either meeting.
All right. So further to Commissioner Bernard's inquiry, there were questions regarding the compensation structure. I'll just use that term loosely. Was that question, did that arise from your internal deliberations? And I'm not going to start cross-examining you guys on this stuff. We don't get involved in this often. But did you come to that question or lack of clarity on your own, or was it brought to your attention by anybody?
We talked, as we deliberated, because it's a fairly lengthy deliberation, because there's a lot of material to cover. As we went through, We wanted to make sure that we had apples to apples when it came to the wholesaler and intermediary commissions. We did see it in Brown and Brown's proposal, but what happened was Arthur J. Gallagher, it was in their proposal, we asked them to list the names of the wholesalers and intermediaries that they may use and determine whether or not they actually were associated with whatever broker, the broker in question, whether it was with Arthur J. or with Brown and Brown. They listed their commissions there. And then Brown and Brown listed their commissions in a separate portion on the price page. Neither one of those necessarily is wrong. It just they were listed in different spots, and the group wanted to make sure we had all the information.
And
Did you
Mayor,
have to
just
make?
to clarify, it was actually the selection committee.
Right.
I believe
Yeah.
I asked the question. Actually,
Okay.
I remember dialoguing with purchasing about how we could address the fact that we needed that clarification.
So it wasn't clear on its face then?
We were in the price proposal portion of the RFP, and Brown and Brown had the information listed, and Gallagher didn't in that section. And so we dialogued with Ms. Pagel, who was the purchasing manager, about what the selection committee would be permitted to do under the process. And she advised us that we could recess, ask for written clarification, and reconvene.
Did
if
that process happen?
Yes.
And was correspondence sent to both applicants? Or just
Correspondence-
to Gallagher?
Correct, no, to both applicants.
Okay. So you needed clarity on Brown and Brown's proposal as well?
Clarity on Brown and Brown's proposal on the computer system.
Both questions were asked to both vendors, because Brown and Brown there was a question about the computer system for Brown and Brown, and there was a question about the wholesale intermediary commission. And I believe, and Kathy can correct me if I'm wrong, I believe the practice is that when information goes out pertaining to the RFPs, both vendors get a copy of everything. So both questions were asked to both vendors, and both vendors answered both questions.
Okay. And so was the second meeting, the June 4th meeting, was that necessitated because of the questions that the committee had, or was it previously scheduled as part of the process?
It's already scheduled. There's a second meeting that's always scheduled, and we use that time date to basically have our second meeting.
Okay. But would it have gone forward if there were no questions by members of the committee?
Would the second meeting have happened? If the selection committee would have felt like they had enough information to reach a conclusion after the first meeting, the second meeting would not have happened, no.
Okay. And were questions posed to either of the bidders at that first or second meeting directly, or was it all through
I
correspondence?
don't believe that's the practice. I don't believe the selection committee interacts with the audience. Other than at the initial opening of a meeting when the audience is given a chance to say anything if they'd like to. But other than that, the selection committee is there. The meeting is in the sunshine. Folks can sit in the audience, but they're not allowed to speak at those meetings.
Okay. Unless you invite them to speak, I assume.
Is that
Okay. Because Nancy, you had disclosed to me that there are oftentimes, or maybe it was Ms. Baker, that there's oftentimes a dialogue that occurs between the applicants and the committee in real time, maybe like an interview or something like that. I've never participated in one, obviously.
So there is an oral presentation meeting date that is part of the timeline. But it's not uncommon for selection committees for requests for proposals. In fact, most of the time, we actually looked back on that to see how common it was that selection committees would opt not to do the oral presentations. And it's quite common for selection committees to use the information in the written proposal to score.
May I clarify?
Yeah, please.
A point? We've got two processes that we use with the selection committees. One is under the procurement ordinance, and that's the explanation you're getting today. We have another selection process that goes through our capital departments, such as FDO, utilities, et cetera. Those are handled separately. We've got our policies and procedures in place for all of them, but it is not under the actual procurement ordinance. So those are the ones that we normally, and I served as the deputy county administrator for a number of years, and I would sit on certain selection committees for those capital type. And so those would be presentations, and then that's the interaction that would occur. But in this particular case, it's allowed if it's necessary, and they operate under a different set of procurement rules than what my capital departments do. I just wanted to make sure that that was separated, and we're really talking about a selection committee under the procurement ordinance, not under our capital.
All right, so it sounds like capital, they're building things and they're, you know, there's maybe some more value in that dialogue versus the services
Definitely.
provided
Lots of
here, which
value in
are
those, yeah.
on paperwork, so to speak. There were some other instances of opportunities to meet. I guess, like, I don't know what a pre-bid meeting is. Can you explain that to me?
Yes, it's a meeting that is on?
Is it on? It's, yeah, it should be on. Just get closer.
It's a meeting.
It's on. Just give it 10. Yeah, you're good.
Got it? It's a meeting where my staff meets with any prospective bidders or proposers who plan on submitting a proposal, and we go through the RFP, and they have a chance to ask questions, and we tell
Did that
them.
process occur here?
I do not believe it, no, I don't believe it did.
I would say, though, that, sorry, prior to going to solicitation, it usually starts about 8 or so months ahead of time. We start to get calls from brokers that are interested in pursuing business with the county, and we do meet individually with every broker prior to going under, the cone of silence and the process starting. We meet with them, lay out our expectations, tell them what we're looking for, because it's important to me that whatever RFP that we write, everybody understands that our goal is to do the best we can for the county. I'm not necessarily, it's always very difficult, but our loyalty is to the county, to get the best possible situation we can, to get the best services we can, to get the best contacts with insurance companies we can, so that we make sure that at the end of the day, in a very transparent way, the county has gotten the best opportunity for the best broker to make sure that we can achieve our goals.
All right, so that's sort of an informal process in lieu of the bid pre-conference?
Absolutely, because we're not, at that point, it's just a meeting. We're not under any bid. We're not going out for any bid. There's just a bid forthcoming. And obviously, vendors want to talk to us and say, hey, tell us a little bit more about what you do, what your process is. And we'll meet with every vendor once and just kind of lay it all out for them.
Did you meet with any vendors in this instance?
We met with quite a few vendors. I can tell you that both respondents we have met with, including Brown & Brown Priya. And Arthur J. Gallagher. We met with Aon, who also submitted a bid.
All right, because there's reference in the correspondence that the board received by Brown & Brown Insurance, I think we received it yesterday, that references a pre-bid conference. And so that's inaccurate. There was no pre-bid conference.
There was no
That is
pre-bid
correct.
conference. No, and it's not, to the best of, I don't think in all my years here, in 22 years, I don't know if I've ever attended a pre-bid conference unless it was for some type of construction. And I believe it's mandatory for that. I don't want to speak out of turn. I'm not a purchasing guru, but.
Well, I think that may point to a larger issue of accommodating new applicants and entrants into our processes of being awarded business by the county. If there aren't pre-bid conferences, and there haven't been for 22 years, versus an informal having to know who to call, who to speak to, getting a call back. I think a pre-bid conference, and I may be speaking out of turn, gives some structure and equity to understanding how to effectively participate in our businesses and practices within the county. But in any event, it was alleged that there was a pre-bid conference, and now I'm clear that there wasn't. With regards to I would say the largest expenditure of county funds in this RFP, which would be the commission side of things, not the fee, so to speak. What is the difference between the two applicants. One said 4 to 6% and one said 6%. Can we have some more clarity on what the true cost and proposals are from the two candidates
Sure,
here?
I'd be happy to do that. As I mentioned in the last renewal, which was 4-1, the commissions that will be paid out in that were approximately $980,000. This is approximately $1 million contract. If you include, that includes the $280,000 that Arthur J. Gallagher would get directly, and then the wholesaler intermediary commissions.
Which that's where they're purchasing insurance on our behalf.
Where they're
but
purchasing
not-
insurance on our behalf, yes, sir.
Not from their own line of insurance.
They don't sell any, they don't have their own line of insurance. They're a broker, so they reach out to different insurance companies.
Okay.
Many of them are very, very specialized. We have a lot of tremendously specialized policies through Lloyd's of London and other folks like that. So, you know, they're markets that aren't necessarily just available by talking to State Farm or somebody like that. So we do need somebody who's very specialized that understands, you know, our market and what we're actually looking for.
So give me some more clarity on what the proposals really are, on the commission side.
Okay. Well, I mean, we access for property, for example, we have a tower where we may have 25 different insurance companies that take part in that. Obviously, the higher up in the tower per se you get, the cheaper the insurance cost is. So the way we have it set up right now is we have a 0 through 25 million, and then 25 million excess of 25 million, and so on, and it goes up. So what we try to do is we try to reach out and find the carriers that are through Arthur J. Gallagher and their wholesalers and intermediaries. You know, not everybody just writes this business, so they'll reach out in their network, and it may be through their contacts with Arthur J. Gallagher in London, because they have an office in London, whomever it may be, and they establish these relationships, and then we also are involved in there based on our risk tolerance, based on our funding, based on what we want to see happen. We work very closely with them. And then their commission structures are set up accordingly. Now, it may be that a commission structure is X, but you know, because of the partnership they have, maybe the commission structure can get a little bit less, but they certainly can't do it at the expense of the cost of the insurance, because there's something called rebating. And I'm not an expert in it, but I know that you have to be very careful about how you do those things. So the structures for commission may be different based on who they have to buy the insurance from, how much capacity that carrier may have, you know, because we're not the only client that they have. So we try to work very tactfully with them. We try to work with different insurance companies that may give us multi-year deals, for example, so that we can keep the costs down, because a lot of times if you can cut a deal and get a multi-year deal, then some of the other carriers fall into place. But the commission structure is always very interesting, and it could change from year to year. And I think the reason that we get a range is because I can't tell you 2 years from now what our insurance is going to cost. We're in a very difficult market right now. There's been times when the market wasn't, you know, the market was there was a lot of capacity, things were going great. We were able to buy additional wind coverage to better reflect, you know, the county's exposure to the modeling, but it changes from year to year. So I think that's why there's a range, is because they can't back themselves into a corner. They need to make sure that they have the flexibility to make sure they have the carriers to service our account.
So is there any distinction between the two proposals in terms of commissions?
I think an average of 4 to 6%, and then something between 4 and 6%, in my opinion, are very close together. I'm sure that, you know, somebody may feel differently, but I can tell you that I ran the numbers on Gallagher's, and as I mentioned before, it was about 5.5%, give or take. I don't remember what I said before, and I don't have the actual number, but it was less than 6%.
That's looking backwards, I assume.
That was just the policy we just placed.
Okay, but
Yeah.
in moving forward, based on the proposals, is there a distinction between the two?
I don't believe so.
Okay.
No, I don't believe so.
I think that's all the questions I have for you guys at this time. There are some more questions that popped up. Vice Mayor Weinroth and Commissioner Marino.
Thank you. All right, give me a lesson in insurance for a minute here. I buy homeowners insurance, I go to an agent, I get a price, I either take it or I don't take it.
Yes, sir.
We go to a broker, what's the difference?
I think the difference is I can't buy insurance for our risks through State Farm or Allstate or one of the others. We have to have a broker because we buy a lot of surplus lines coverage. And what that means is it's coverage that's not necessarily protected by the government, the federal government. A lot of the coverages for our houses and that kind of stuff are underwritten by the government. It's almost like the FDIC for savings and loans. But because our policies are in many cases manuscript, meaning they're not a standard policy, they're written specifically for our risks. You can't just buy them from an insurer that a normal insurance agent would have access to. You have to go to a specialty broker.
So, whereas I would be going to an insurance agent who, has a license and has a relationship with some insurance companies, I'm assuming that we're looking at a value added that a broker is going to bring to the table, and that professional acumen is going to make it more competitive for us as we go out into the market and find places where we can get the kind of coverage we're looking for at the most competitive price?
Yes, sir.
As I look at the evaluation criteria, I don't see a real difference between a company that is in business for 94 years and one that's in 82 years. Would you grant me that there's really no material difference between a company that's been around for 8 decades and one that's been around for 9 decades?
I would 100% agree with you.
But we're still looking at a 6-point differential between those two. So at the end of the day, we would both agree probably that if we were staring at those two companies, neither one of them would be a farm team versus the major leagues.
Yes, sir. I would like to point out, though, that the 6-point difference is spread out over 5 people.
I understand that, and so that each person had 20 points to put on the table. There was a maximum of 100 points, but at the end of the day, with those 5 people making an evaluation, whether it was a 6-point spread or a 10-point spread, is there a real material difference between these two brokers as to their experience?
Their experience, yes. And I think, that was one of the things we talked about a little bit in here. It had to do with the type of agencies that they service, the size of the agencies. There's a huge difference between a smaller governmental agency and a very large government agency. And just even the way we would look at structuring our programs and the suggestions that they could make, there could be a difference. And I think they're very closely scored together, but I think there is a difference between, a broker who works for Broward and Miami-Dade versus a broker who may work for some smaller counties and cities. And I'm not going to sit here and tell you, Brown & Brown is a fine broker. I think, as I mentioned when we spoke, we're in a great situation in that we have 2 very solid brokers that have bid our business, and so this is a no. I mean, we win either way, but I think there is a difference when you look at if you look a little deeper than just the years in business.
So we both agree that we're dealing with 2 high-quality brokers here.
Absolutely.
Okay. The mayor alluded to the fact that the largest expenditure here is the premium, but really the largest expenditure here is the commission, but the largest expenditure is the premium.
Correct.
How do we evaluate the effectiveness of the broker in getting the lowest possible premium at the best possible coverage?
Okay, good question.
Okay.
You can tell I can tell you're an insurance guy, and so here we go. When we went out for our 4/1 renewal, I talked to a lot of my counterparts. Some of them are in public sector, some of them are in private sector. And I even talked to some of the other brokers that were potentially at one point or another interested in our business. And what I was hearing is in the industry, there was a 15 to 18% increase. The industry is getting just clobbered right now, and I think the storm we're having in Texas isn't going to help that either. We ended up, when we came to the board, I believe we were somewhere at about a 12% increase. Interestingly enough, we continue to market until basically the day that policy renews. But we have to come to the board about a month early because we have to get in line and make sure that we have everything squared away. When we were done, we were at just over 8% was our increase. So one of the ways we can do that is I talk to my colleagues and see what else is available out there. And I think that's important is we don't give our broker just the key to the car and they're driving. They're a passenger in our car. And I think that makes a big, big difference in that they'll give us options. When it's time to renew, we get options on what we want to do and how we want to handle it and what we think is in the best interest of the county from a risk standpoint. You know, what is our appetite to take on more risk? Why do we have the deductibles we have? You know, that all factors in, and I certainly don't make the decision in a vacuum either. We work with our staff to do that. I work with our assistant county administrator and our county administrator. We make these decisions.
How long have we had a contract with AJG?
We have had a contract with AJG for over 30 years. But I will say that we go to bid every 5. And when we do, it's a fully transparent bid.
How often have they come in with a reduction in premium on particular lines that they've gone out and brokered for us?
Bear with me for 1 second because I have that sheet. So if you can give me 1 second here. We went through a number of years where we would come to the board and because we were sometimes six weeks out, we would come to the board and we thought we were going to spend X amount on insurance. I have it budgeted. You know, there was an opportunity. We have models that we put our information into, and we were always concerned that maybe we needed a little more wind, for example. So in 2015 and 2016, we bought more wind. We started the process. We went from 80 million to 100 million in wind. And our premiums were, for everything, this includes a lot of different things, but our premiums were 10,400,000. In 2016, 2017, I kept the 100 million wind and dropped our premiums $1.1 million.
Was that a result of the market capacity and things outside of AJG's competitive abilities to?
I think it's a result of both. You know, they look for always the most advantageous ways, whether it be to enter into a multi-year agreement with one of our insurers. And if you can enter into that, particularly in one of the lower layers, it causes a lot of other people to fall into place. And so it was probably a little bit of both. I mean, as you know, the insurance market is very, very volatile, and if people see an opportunity, if the carriers see an opportunity to increase premium, even if they haven't had the losses, they're going to do that. So I think it was a little bit of both.
Vice Mayor, I was wondering if you would accept a question from Commissioner Bernard on one of your points.
Absolutely.
Thank you very much, Mr. Mayor. Scott, you had mentioned that, you know, I think the Vice Mayor asked the question in regards to how long they've been our broker, but I'm looking at the letter that they had submitted. It says that they've been our broker since like 1977.
Okay.
Is that correct, or?
I would have to verify that. I've only been here 22 years. I would have to verify that, but I will tell you our process, once again, has been, you know, to go out every 5 years. Last year was the first exception because of COVID. There was a backlog, but I would also say that doesn't mean we've had the same people for that time frame, and I think that's important. We do keep, you know, fresh folks coming in with new ideas.
Thank you very much.
We're dealing today with property and casualty, but there are other lines of insurance out there,
Absolutely.
workers' comp being one of them. My understanding is that Brown & Brown is the broker of record for the workers' compensation?
They're not the broker, they're the third-party administrator.
Oh,
The
TPA?
broker, yeah, the broker of record for our workers' comp is actually Arthur J. Gallagher. We buy excess workers' comp, we self-insure our workers' comp up to the first $2 million, and then we have like what we call a sleep-at-night policy, just in case, God forbid, the catastrophic event happens.
Is Brown & Brown a broker in any of our
They are not.
insurance?
They're third-party administrators for our workers' comp and third-party administrators for our property and liability.
And they assume that from AJG?
The workers' comp, they've been with us since day one when we decided to, in essence, outsource our workers' comp. And the Brown & Brown contract for property and casualty, we're about 2.5 years in, I want to say. That was through a competitive bid process. We had Gallagher Bassett, which is a part of the Gallagher umbrella, for a very long time, probably about 30 years. We went to a competitive bid process, and Brown & Brown won the business.
Since Brown & Brown won that bid, have they been able to reduce premiums?
I wouldn't say they've been able to reduce premiums on the casualty package. The casualty package is always very tough for us. It's a very small part for the, you're talking about for the liability purposes. We have, and it's always fun to go talk at different places, and you start to tell them we have 4 airports. We have 2, Major League Baseball facilities, an equestrian facility, 50-some fire stations, over 100 parks. Everything we do revolves around liability. So they haven't necessarily decreased it. I think we're running smoothly. I think we're COVID has helped, frankly, more than anything else. Not as many people rode buses for a while. People have been at our parks more, which has been great. So, but as far as any noticeable change in our liability, I haven't seen a ton overall.
You mentioned rebates. What is our control of rebates? Do we get those rebates? Who gets that?
I think rebates are illegal. Is my understanding, and I'm not an expert. You'd have to ask a broker, but I don't believe you can do rebates, and I think that's one of the reasons that
You had alluded to rebating before.
I'm sorry. What I probably didn't convey well is sometimes you're limited in how much of a percentage in commissions that they can maybe negotiate down and that type of stuff, because it can't be done at a negotiation that's going to reduce premium or those type of things, because it could be considered a rebate. But to the best of my knowledge, rebates are illegal.
When you were talking about the premiums, how come for AJG you say a flat 6%, but for Brown & Brown you say 4 to 6?
It says not to exceed 6%, I believe.
Not to exceed
an
6%.
average of 6%, correct. Because there may be some carriers, if we have something that's very difficult to place, it may be 11%. But then some of the other policies, they may take no commission. So it just depends on the relationships they may have. And I will tell you that I'm not an expert in how they interact with all the different insurance companies. But obviously I try to stay versed on all of that, because that's my job.
As I look at the approach to service, the biggest difference I'm seeing is AJG talking about maintaining the self-insured retention, and Brown talking about trying to reduce the current self-insured retention. What would that do to our premium if they were successful?
Well, I think what's fascinating, let's break them down individually if I can, just for a second. If it's okay, I'll start with Priya, Brown & Brown. If they reduce and this is obviously my opinion, as your risk manager, I could reduce our self-insured retention. Currently, it's at $1 million right now for property. I could do that, and I might be able to file a few claims, and I might be able to save the county a little bit of money short term. But long term, there is always that possibility that my experience has gone up now, and my rates are going to get raised.
So the frequency would obviously be to our detriment.
So what we've always tried to do is we self-insure the stuff we can predict, and we buy excess insurance for the stuff we can't. And we have set our policy limits for self-insured retention accordingly based on that.
All right, I think that's all the questions I have. Thank you.
Thank you, sir.
Very good. We'll go to Commissioner Marino.
Thank you. Actually, Vice Mayor Weinroth asked all the questions I was going to ask. But looking at the final scoring breakdown, and the reason that we're here today is there was a bid process.
Yes, ma'am.
And it was not won by Brown & Brown. And Brown & Brown is protesting. Or what is the right term for that?
Protest is the right term, yes.
Okay. But at the end of the day, in the final scoring breakdown, with 5 people who had all the same information, A.J. Gallagher won 5 of the separations, that's not the right word either, 5 of the criteria. Brown & Brown won 1 of the criteria, and 1 was a tie. So at the end of the day, Arthur J. Gallagher won 5, lost 1, and tied 1. I feel like I'm in a baseball game. But is that accurate to state that way?
Yes, ma'am.
Okay. And Brown and Brown has other opportunities with the county?
We do have 2 partnerships currently with Brown and Brown, yes.
And do we have other insurance opportunities out there? Or is it just 3 different policies, 3 different?
We have, if we step outside of what we're talking about today, obviously, we have our health insurance, we have our dental insurance, we have our voluntary benefits with Washington National that we have. We just had a short-term and long-term disability RFP that we're negotiating right now. So there are other avenues out there.
So from brokers that work with the county right now, so we have Brown and Brown. We have, did you say Aon have they done any brokerage work with
No,
us?
Aon bid it, but they didn't do it. But I think I know where you're going,
Small
and
business.
the answer is for this particular type of work, no, there are no. It's a single point broker that will handle all of this.
Okay. But as for being brokers for the county, Brown and Brown has a contract with us for 2 other,
Their
the third
subsidiaries
party.
are third-party administrators, yes.
And Gallagher, do they have other opportunities with the county other than this one?
Gallagher has one agreement right now where it's a small contract for a benefits consultant.
Okay. So it's not like one has all and the other one has none?
That's correct.
Okay. So I'm actually I'm comfortable with the information that we've been supplied. I think that we've covered this well, and if there's no other questions, I'll make a motion.
Well, we still have public comment, and I'm going to give opportunities to both applicants to speak as well, so we can take up your motion after public comment. Commissioner Bernard, you're recognized.
Thank you very much, Mr. Mayor. Scott, you had mentioned that this is a protest by Brown. Are we here on a protest by Brown?
No, I'm sorry, and if I said that, that's incorrect. There was a protest period of 5 days from the date that the contract was awarded. There was no protest filed, but it seemed to indicate that there was a letter that was sent yesterday that I received a copy of that seemed to indicate that they were, I don't know if it was called a protest, but they were saying that based on, the following reasons, they don't agree with the decision. But that was not, I think in my presentation, all I was really saying was that there wasn't a protest filed within the 5 days by Brown and Brown.
Hold on one second. Madam Administrator, you're recognized.
No, I was just simply going to say this is not a protest, just to clarify it. We brought a contract to the board. The board told us to bring it back and to provide additional information. So that's what we've done, and we're laying out the process in which staff followed in order to make the selection and recommendation to the board. We brought this back because the board directed us to bring it back, not a protest because of Brown and Brown.
Commissioner Bernard?
Thank you very much. Yeah, I just want to make sure to confirm that, this was, I'm the one who pulled the item off the agenda, and, Brown did not protest, and, I wanted to get more information on this item, which is why we're here. My other question is, I know that I looked on page 10 of your slide. You had mentioned. Can you give us the number in terms of you had said like there's a percentage of the team that's that's locally. Can you go back to that if you don't mind, please?
Sure, absolutely. Let me pull it back up and put it on the board because that may help. Because as it was pointed out, it's very difficult to read. So on your printout. So. Okay, hopefully that's a little bit better. What I tried to do is both brokers had fairly significant service teams. So what we tried to do was look at the locality of those teams. So what we did is we looked at everybody who was in Florida, and we put them on this spreadsheet. Or these 2 samples. And then based on that, 12 out of 14 of Gallagher's proposed team members, which is 86%, are from Boca Raton, the Boca Raton office, whereas Priya had 7 out of 14, which is 50%.
Thank you very much. Follow-up, you had on slide 9, I know you had mentioned the team lead, which is, I know you had mentioned Judith Ahrens, which was based in Boca Raton, am I correct?
Correct.
And then you had said Michelle Martin was based in Daytona Beach, Florida.
Correct.
So even though that you had mentioned that 86% of Arthur Gallagher's team was from Boca Raton, and 50% of the team for Brown and Brown was like out of Daytona Beach or locally, but none of their team showed up to any of the conferences on May 24th or June 4th. Is that correct?
That is correct.
Okay, thank you.
Thank you.
All right, Commissioner Sacks.
Thank you, Mayor. And the one score, and I wanted to ask you about reinsurance, and I'm not an expert on insurance, but I do know a little bit about reinsurance. Do both companies rely on the same reinsurance companies or do they rely on the same companies, insurance companies, for their reinsurance, and which ones are they?
Well, I think the reinsurance, and I'm going a little bit out of my comfort zone a little bit, but reinsurance usually has more to do with an insurance company is only allowed to sell a certain amount of capacity based on how much financial backing they have. So what they may do is they may buy insurance for their insurance to increase their capacity.
But do we know which, is it Lloyd's of London or which?
Well, I don't know which ones on our group would have it, but I think that we only deal with financially sound based on the AM Best ratings as far as the companies that we use, and we get a list of those companies, and so we know who they are. And I think one of the things that I would also say is I personally get to meet with some of the underwriters from some of the companies we use. So we do look at these companies on a lot of different levels, because when you have long-term relationships, when stuff gets bad, matter. And so
we have about how much $1 billion of county property are we insuring?
2.6
billion.
$2.6 billion with a B.
Of county
yes, ma'am.
property
Yes.
that we are insuring. So we are, as you all have been examining this, you feel confident that each of these companies has enough reinsurance to cover
Absolutely.
this in case of a catastrophe.
And many of them may not have reinsurance at all. They may be off of their original capacity. They're only
but
going
the two that we're discussing, each of the Brown and the Gallagher,
Brown and Brown,
each one of them has sufficient funds
we
to
require
cover.
insurance from them, and we even require cyber liability that we talked about earlier. But as far as insurance, they carry insurance for errors and omissions and those type of things. But they're not placing any of their direct. They don't have direct insurance policies at all. They basically help us place policies with insurers. They're not actually an insurance company.
And I want to state that the last time this came up before the board, there was an issue, and I don't think any of you expected it that we would be wanting to look at it a little closer, because it is a big deal, especially today with the losses that many states are suffering and counties. So, and I asked for more information, and I want to thank Nancy Bolton for providing good reading material for bedtime, information on this, and I was supplied a sufficient amount for me eventually to make a decision. So thank you very much for this, and this has been very well prepared.
And we do welcome the board's interest in our insurance program. I mean, we really do. Thank you for
How much risk is being insured through this contract? Is it the $2 billion footprint of the county?
Here's what we have as far as our plan goes. We have $200 million of property, and then we have a sub-policy, a different policy for utilities with $50 million. And the rationale for that is a lot of our utilities is underground or storage tanks or something like that, and nothing's going to happen to those. So we buy a little bit lesser limit. We have $200 million of property, and then we have $130 million, a sublimit for wind, basically.
And that's based on catastrophic modeling and our
Right.
probable maximum loss
So
and those types of things.
our catastrophic modeling has us somewhere just sub 120 million for the, and I have that somewhere here too, but for the 100-year storm, which is what we base it on, obviously you run into the concern that it seems like we're having 100-year floods every 2 years. But in general, we're trying to match that. So what we've also done is, when we talk about, because I know one of the concerns was, or one of the questions that I think is very obvious is, what are we doing, what innovative ideas are we putting in place? And I mentioned we've gone from 80 million to 130 million of wind in the last 6 or so years. We've also taken our deductibles and we've dropped them from 5% to 4%, with a $25 million cap. So in other words, the most we will pay in deductibles is $25 million, and then we have a full $130 million of wind that kicks in.
All right.
We're also looking at different ways in the event we have multiple storms. I mean, all of this stuff is looked at on an annual basis. I mean, I go all the way back to Francis and Jean. I was here. And, you know, we had multiple storms in a year, and we're certainly working on that aspect of it. But our first and foremost goal was to bring the wind up and bring the deductibles down. And I think we've done a really good job of that through some innovative processes over the last 4 or 5 years.
Believe me, we commend you for your proactive approach to it. But the question that I'm trying to get answered is, on this contract before us today, how much risk are we insuring against? Is it $380 million total?
Well, I think you need to look at each, no, it's 200 million, and there's a sub-limit of wind for 130.
Okay.
So it's not 330 total, it's 200 million for property damage, excluding wind and flood, basically, and then the 130 would be for the wind.
So 330 million? No.
No.
Okay.
So we have 200 million worth of property coverage.
Right.
Okay? That's period. And then we have a sub-limit, which is a lower limit. Within that 200 million, it's 130 million for wind.
Okay.
Is that,
So
did I do better?
I think it's not you doing better, it's me doing worse. So about 200 million?
Correct. And I will tell you from like wind, for example, you know, there are other avenues. FEMA obviously factors in, but one of the struggles is I don't like relying on FEMA because the payout takes quite a while, in all honesty. And then secondly, as the board knows, many of you know that they do come back after the fact and want some money back. So our goal is to put ourselves in the best situation to get money as quickly as possible. And that's why we have 130 million of wind.
Of that 200 million in coverage that we may realize from this contract, what portion of that would be assessed commissions by whoever wins?
Every bit of insurance we place has a commission attached to it. In some cases, they're able to not take a commission, maybe if they have multiple, and I don't know how that process would work, but the report I have shows, you know, there may be very small or no commissions in some places, and then larger commissions in others. I think it just depends on the market, but
Well, I mean, the commission's realized by whoever.
At the end of the day, anytime we buy insurance, there is a commission.
And I get that, but what percent or portion of the 200 million could be exposed to commissions that the winner of this contract could realize?
Their commissions would be the fee, whether it's 270 or 280 million. I mean, 2 million. Now I'm confused.
Don't mess with me.
Yeah, now I'm confused.
I just
the
finally figured it out.
270,000 or the 280,000, and then the balance of the insurance that we purchase for the amount. It's not based on the 200 million. It's based on the cost. So, for example, if we spend, for example, $13 million a year on insurance, and that's just a round number. It's not really that round because that'll mess up my math too. But at the end of the day, they would collect commissions on that equal to the 6% is what I think, as I did the numbers, it came out to about $1 million in commissions.
Okay.
Period.
All right. That makes it much more clear. Thank you.
Yes, sir.
Vice Mayor Weinroth.
So how much are we spending annually for our premiums on these coverages?
Our premiums right now are just a shade under 13 million. I want to say we were at 12 point something, and then we also have on 10/1 we have an insurance renewal for our airports, which is usually about 130 to 140 million. That's the best coverage we ever bought. 1,000. Now I'm really okay, but it's about 130 or 140,000, and it's the best coverage we ever bought because it's first dollar. There's a claim, we turn it over to the insurance company, we never see it again. But if you add that in, and then there's some small ancillary policies, like we ended up buying a policy at Fire Rescue for their training center because we have some folks from the outside sometimes that come in. So we brought like an AD&D policy for a very small amount of money to cover co-pays. We have a fine arts policy with the Murakami Museum because we take stuff in on loan sometimes. So there's some ancillary policies, and ironically, the ancillary policies don't cost as much money, but sometimes the commission is higher because it's specialized.
My problem with this evaluation process, and I don't know how to correct it, is that the real value of the broker is their efficiency in placing the coverage at the best cost. And I don't see that measured in any way in these criteria. And, you know, I asked you before about how long Gallagher was with us, and what was the answer? How many years?
I can tell you that it's at least 30. I mean, the
All right, well,
information that was
whether it's 30 or
supplied said-
35
yeah,
or 20 or
yes,
25.
correct.
But, you know, my concern is someone who's been there that long sometimes, and I'm not saying this is the case here, gets comfortable with the contract they're having and not being real aggressive to try and see, can I wring out another 2 or 3%, get a lower premium? And when we're talking about $13 million, 2 or 3% is money.
Sure.
So my question is, how do we measure the efficiency of broker A, in this case AJG, and broker B, which in this case is Brown, or Aon, or anybody else? How do we measure the ultimate efficiency at getting the best possible price?
That's a great question. Thank you again. You know, as I mentioned before, a lot of times I'll check with my counterparts. You know, in a perfect world, you'd put out an RFP, and you'd basically say, this is my coverage. You guys quote it and tell me what the answer is. You're not going to get brokers to, or you're not going to get insurance companies to do that. They can't keep up with their quotes now, to let alone do a fictitious quote for something that may or may not happen. They're going to do a bunch of quotes and not get the business. The other thing is, and we do ask this in the RFP, there's only so many insurance companies out there that will write our business. So one of the questions we ask is, this is who we have. We send them a list of who we have, and can you write coverages under that? The other thing we do is when we go out for bid, we ask for innovative ways. And one of the things I will tell you is Brown & Brown suggested some very innovative ways. But we've tried most of those, or at least contemplated most of those already. And it's not their fault. It's not at all. That's not at all what I'm saying. They had great out-of-the-box ideas for us to consider. You know, parametric coverage and some of the other stuff, which we have considered. And like I said, I'm not sitting here saying that there's anything wrong with anything. We're just basically, and I know we've gotten probably away from this, but you know, we wanted to make sure that the process was laid out, and this is how we arrived at what we arrived at. And you know, it's my hope that at least we've added some clarity there to, you know, this is how we got where we are. But by all means, what I've said before is the broker, it's not as though our staff, I take great pride in my staff, and we don't sit on our hands and let the broker run wild at risk management. You know, we're always pushing them to cut better deals. We've pushed back on things. We've gone to different places. Like I said, I go to different conferences to personally meet with the underwriters to get a better handle on exactly what's going on. So I make sure that I understand what's coming next. And that's really the best answer I can give you, and I'm not sure I answered your question.
No, and I don't think there is an answer, unfortunately. I mean, we think we both agree to the same thing. We want to get the best value for our...
My only concern is the county.
Right.
And I'll be as transparent as I can be. You know, I've been doing this a really long time. I know a lot of people in a lot of different places. But at the end of the day, if the county doesn't get the best deal, then I haven't done my job, and I think that's my job.
And certainly, I'm sure, excuse me, I'm sorry. I'm sure Brown is basically saying, look, we can do better. And I think that is what we are looking at.
Sure.
I've been doing it all this time. You know, you're comfortable with me. I can do better. And that's basically the two parties that we're staring at. Okay, thank you.
Thank you.
No, well said, Vice Mayor. And you know, some of this I think comes down to strategy of the two applicants, and that's been sort of contained into one slide, which is on page 4, the second slide. There's sort of an evaluation of this company would maintain the current strategy. The other one would negotiate each market separately, and you know, at the end of the day, it comes down to a decision by the board, which we have done in the past by making a commitment to re-energizing and rejuvenating the types of businesses that can access business with this county. And while thousands, maybe thousands of these contracts come through on consent agenda and we don't delve into it, on this particular one, and much appreciation to Commissioner Bernard for bringing this to our attention, there was an item that is very subjective in its evaluation is the only way to describe it. It's nothing that the staff did wrong. You have to try to assign objective standards to subjective evaluations. But I think what's happening here today is sort of a restating of our commitment to analyze the decisions that come with our signatures and our votes, and that's not against the prejudice of any particular applicant. So with that said, unless the board doesn't want this, I'd like to give each side 5 minutes to make some comments directly to the board. And so, yeah, I think there would be some value in that. So if we can start with Gallagher, you'll have 5 minutes. This will preempt any public comment cards that you've submitted. Opportunity to meet face-to-face and speak directly with the ultimate decision makers on this.
Mr. Mayor, I'd just like to remind you that we have the 1 o'clock meeting.
Very good.
So a quick 5 minutes?
No, I don't want to preclude you in any way. We have about 10 minutes, so 5 minutes.
Thank you very much. Good afternoon, and thank you for the opportunity to address the board members and the public today. My name is Zeb Holt, and I'm here today as the senior member of the Gallagher Insurance Brokerage Team from our Boca Raton office. I'm joined today by my colleagues Judy Arns, Tom Gill, Raul Plasencia, and David Daly. We're humbled and grateful for the opportunity to have continuously served Palm Beach County for more than 40 years, dating back to when our records show our partnership began in 1977. Throughout this period of time, our firm's capabilities and services for the county have been reviewed and compared with other insurance brokers by way of the county's formal procurement process every 5 years. This regular due diligence has concluded Gallagher has consistently provided the best combination of professional services expertise and results with the cost to provide these services to the county. The conclusion for the Insurance Broker Services RFP was no different than in past years, as the evaluation committee unanimously scored Gallagher the highest relative to other competent and responsive competitors, and has been recommended a new contract be awarded to continue this successful partnership. Given the tenure of our working relationship with Palm Beach County, it's natural to wonder how and why Gallagher has maintained its role as the county's insurance broker for all of these years. Simply put, our mutual results speak for themselves. We have spent decades investing in our people, capabilities, and resources specific to governmental entities, and we do so to the degree that our other insurance broker competitors typically do not. Our long-term partnership with Palm Beach County is not unique. In fact, it's quite normal. Throughout the United States, we have long-standing relationships and serve more than 13,500 cities, counties, parishes, villages, special districts, state governments, and K through 12 public school districts. Specifically here in Florida, we are leaders in the space with our public sector practice as the largest in the state, with more than 115 governmental entity clients, with many of these clients similar in size to the and complexity of Palm Beach County, such as Miami-Dade, Broward, Hillsborough, Pinellas, and Orange counties. Let's face it, and we've talked about it very much so today, the insurance marketplace is both complicated and dynamic. It's constantly changing, and Palm Beach County has had the steady hand of a broker that has a deep understanding of the county's risk and exposures and the technical expertise to navigate the volatility and turbulence of a very challenging marketplace. Each year, we approach these risks with a fresh perspective and leading innovations to produce the best possible results. While the feeling may be that another service provider may be required to provide new options, the innovative ideas proposed by the other respondent have already been previously reviewed between county risk management staff and Gallagher. These recycled and repackaged ideas may appear on the surface to be new. However, without the full understanding of the county's risk and exposures, needs, and risk management philosophy, such strategies could lead to higher cost, less competition among insurance companies, less coverage where it's needed, and more coverage where it's not. When it comes to insurance, stability, predictability, consistency, and long-standing relationships matter and can often make the difference. Like a good backup power generator, you don't want to find out it doesn't work after a big storm when you need it most. I'd like to cover a few additional items that we believe to be misrepresentations or inaccuracies in the letter Brown & Brown provided to the county commissioners dated September 13th, 2021. Specific to the policy language, concerns, and comparisons, the statements in the letter and those presented today relative to policy language are speculative and pure conjecture. Negotiations of the policy terms and conditions take place during the renewal process and can vary from underwriter to underwriter and are subject to the evaluation of the risk, exposure, and projected claims activity on a specific client basis.
Sir, your time has expired, unfortunately, and probably would have loved to hear more, but we are time compressed. I don't think we're going to get an adjudication on this issue prior to our 1 o'clock. Does that pose any problem for the professional staff or the applicants? Meaning we'll take this item back up after our shade meeting. All right. We may have some questions for you later then. We'll now hear from
Thank you.
Priya, or Brown & Brown as it's known. And you have 5 minutes.
Good afternoon. Matt Montgomery, Executive Vice President of Brown & Brown, and I have with me Aaron Creedy here, who is our property expert on this account. My time was cut short the last time I came before you, Mayor, Vice Mayor, and Commissioners, but it is a pleasure to be here again. I was not granted the opportunity last time to say how deeply we respect the staff of this county. Standing before the county commission and asking you to overturn their decision is certainly something that doesn't sit well with them, and it shouldn't. And I want to personally apologize for that. We do have a great deal of respect for you, and congratulations to the county administrator for renewing your contract. I am going to go through a few things which we deem to be important reasons for our position, but I'm going to pass it over to Erin to give her read on the property policy first.
Thank you. I'm Erin Creedy with Brown & Brown. As we discussed today, how do we evaluate? And when we look at your contract, it is specific for your needs. And so I've looked at it, I'm the property subject matter expert, and I've read it, and I've tried to determine where do we see those deficiencies. Specifically, I see 5 deficiencies within your program. You have a high hazard flood deductible that has language in it that is not market specific. It says that it will be the higher of the named storm or the flood deductible will apply. Typically, we see one or the other. This could result in a $9 million increased retention. There's also contract uncertainty on your surge definition. Surge is defined both in your named storm and your flood. There is a coverage restriction of a 110% margin clause within your policy, which says you get your reported values plus 10%, even though you go through an annual appraisal process. There's an additional coverage restriction in your policy that does not have drop-down language. What that says is that if you have, say specifically, a flood event, that your excess carriers will not drop down if there's a second event. And lastly, we see a coverage gap for your FAA tower. Since it's not owned by the county, if you have an event to the FAA tower, you will not pick up the resulting business interruption loss. And I would say this is extremely technical in nuances of policy coverage wording. I read policy coverages every day, all day long. That's my job. But when I see 5 and even more, I think it just begs the the case to potentially have a new set of eyes look at this policy, read the policy, make sure that it's responding specific for the county needs. Thank you.
Commissioners, I think we could argue any one of those points, but the idea is that the deficiencies in the coverage in the aggregate are creating contract uncertainty for the county, which is unnecessary, and we believe that fixing these issues would not be premium bearing. There's a couple of things I'd like to touch on in my last 2 minutes. You know, what we're asking you to do is to break a 44-year relationship with the incumbent broker, and that's a very difficult thing to happen on its own. There are a few things, despite the policy concerns that you discussed, such as AJG didn't show up for the bid meetings. And there was confusion into their disclosure of, I think, what the risk manager described as about $700,000 in commissions. We just see this as a lack of focus, which isn't surprising based on how long they've had this contract. We believe after 44 years, it is time to put fresh eyes on this contract. As was discussed, the scoring here was very close, 419 to 394, and that's because our team is highly qualified. We do represent very large insurance programs, such as the City of Miami, City of Fort Lauderdale, the State of Florida, and another 100+ cities, counties, and school boards in the state of Florida. And lastly, you know, it was mentioned about the local presence. I would just say, you know, we're very proud to have north of 100 teammates in Palm Beach County, 3 different office locations. That is a highly qualified team that is very hungry to help the county and work with your esteemed staff. And we want to thank you for strongly considering changing course in this matter and your time today.
Thank you to both applicants for your time here today. The time is now 1 p.m., so we will table this agenda item, and I think we'll be back promptly at 2 p.m.
Mr. Mayor, we need to commence the shade meeting before we recess.
Okay. So do you want to commence it?
We hereby commence the shade meeting, and we will recommence the Board of County Commissioners' regular meeting at 1 p.m.
Very good. Can I say we're in recess until that time, or we're not in recess?
I'm sorry, 2 p.m.
All right, well.
We're commencing the shade meeting at 1 p.m. We will recommence the board meeting at 2 p.m.
Very good. We'll see you guys at 2 o'clock. Thank you so much.
Yeah.